am honored. Goddess, watch over you.
I don't like this place.
What brings you here?
I'm out of range. I need to get closer. It's too far away. I can't pass that yet.
Check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Check. 1, 2. Audio check. Podium check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Check. 1, 2. Audio check. 1, 2. Okay. Everybody else good audio? Okay. That won't go bad.
Well, good morning, everyone. This morning, I've declared a state of emergency in the province of Ontario. We're facing an unprecedented time in our history. This is a decision that was not made lightly. COVID-19 constitutes a danger of major proportions. We're taking this measure because we must offer our full support in every power possible to help our healthcare sector fight the spread of COVID-19. The first order under this declaration will be the prohibition of organized public events of over 50 people, including parades and events and services within places of worship until March the 31st. Secondly, the following establishments are closed effective immediately until March the 31st. All facilities providing indoor recreational programs, all public libraries, all private schools as defined in the Education Act, all licensed child care centers, all bars and restaurants, except to the extent that such facilities provide takeout food and delivery. All theaters, including those offering live performances of music, dance, and other art forms, as well as cinemas that show movies and concert venues. Again, this order will come into effect immediately. I want to be very clear about what this means and what this doesn't mean. This is not a provincial shutdown. I repeat, this is not a provincial shutdown. The vast majority of businesses, including those most vital to day-to-day life, will not be affected by this order. Essential services and essential needs will be available to every individual and family. Groceries, convenience stores, pharmacies, manufacturing facilities, public transit, important public services, construction sites, office buildings will all continue to operate. Right now, we need to do everything possible to slow the spread of COVID-19 in order to avoid overwhelming our healthcare system. The health and well-being of every Ontarian must be our number one priority. We must think about our children, our parents, and our grandparents. We must think about our neighbors, our colleagues, and our friends. We must think about the elderly, those with health issues, and every other person across this province. All of these people have been in my heart and on my mind with every decision I've made during this crisis. It is imperative we protect every person and every family across this province. We must act decisively, and we must not delay. As COVID-19 continues to spread, the government must be in a position to take any and all actions necessary. That is why today, Ontario has declared a state of emergency. As I've said all along, we've been preparing for every scenario. This decision was not made lightly. It was based on the advice of our Chief Medical Officer of Health and public health officials. Our cabinet deliberated late into the night and again very early this morning. As we take action to fight the spread of this virus, I want to assure the people of Ontario their government is taking every step possible to flatten the curve. We're taking the steps necessary to protect you and your loved ones. We're taking these measures now while our system is strong and to ensure it remains strong in the days and months ahead. I want to urge calm across the province. No expense will be spared to support Ontarians in need. There's no level of support we won't consider. By declaring a state of emergency, our province will be in the position to act as fast and decisively as needed. Again, this decision was not made lightly. We've seen around the world that jurisdictions like Ontario, who take timely and decisive action, have so far stayed ahead of this virus. We must flatten the curve and help stop the spread of COVID-19. We understand this decision will impact workers across this province. My message to these people is that we will support you during these difficult times. We expect the federal government to support Ontarians with the following measures. They must work with us to establish a loan program to support businesses. Immediate EI reforms must be implemented to support workers. The eligibility criteria must be expanded to include workers impacted by this outbreak. In Ontario, I've directed our cabinet to look at all options necessary to support the workers and businesses during this unprecedented time. That is why today I'm announcing the first stage of our COVID-19 emergency relief package. This is over $300 million committed to supporting the fight against COVID-19. This is the first stage of our larger emergency relief package. Our ministries have been working around the clock to develop a plan that can be implemented as fast as possible. This initial investment of $300 million for immediate measures to protect the health of Ontarians. This funding will also help us protect our seniors and the most vulnerable during this difficult time. We're going to bring 75 more critical beds online, 500 post-acute care beds, and help hospitals set up 25 more COVID-19 assessment centers. We're backing up our frontline public health workers with more resources for monitoring and testing. And we're purchasing more personal protective equipment like masks, gloves, surgical gowns for our nurses, doctors, and personal support workers, as well as more ventilators. For our long-term care homes, this funding will provide 24/7 health screening support for staff and visitors to help protect our seniors, as well as additional staffing for infection control and cleaning supplies at these homes. We're supporting our health professionals. We are providing funding to backfill 1,000 nurses, 1,000 personal support workers to support capacity during the outbreak. We're also providing funds for 50 physicians to cover emergency departments, urgent care, and primary care in Indigenous, northern, rural, and remote communities. We listen to the frontline workers, and this surge funding will back them up in the fight against COVID-19. In addition to the public health measures we've introduced today to keep everyone safe and healthy, and our legislation to provide job security to workers and families, and certainty to businesses. As I've said, we will spare no expense to support Ontarians. This is the first stage of a larger emergency relief package. In the coming days, Ontario will face challenging times. We must come together as a province. Every Ontarian must support each other. I and the entire government of Ontario will do whatever it takes to guide our province through this difficult time. For years, Ontarians have led the world in healthcare, research, business, and ingenuity. We have the greatest minds, the greatest businesses, and the greatest people in the entire world. Ontario will weather through this storm together. Ontario will come out of this stronger than ever before. Thank you, and God bless you.
Okay, we'll take questions now. We'll take questions from the floor first, and then we'll go to the phone line. One question, one follow-up.
Premier Ford, you say that you're doing this with the best medical advice, but was last Thursday you were saying schools would remain open, go on March break. Yesterday, your chief medical officer of health behind you, you may want to answer this as well, was saying he was wary of going below 250 people. The bars and restaurants didn't need to close. Now we're at this stage. What's to say that Ontario aren't right to panic, aren't right to think government and health authorities aren't ahead of this?
Well, I have all the confidence in the world in our Chief Medical Officer of Health, our Minister of Health, and our entire cabinet. This is changing hour by hour, day by day. And we're getting ahead of the curve. We're going to stop the spread, or at least slow down the spread, I should say, not stop the spread, slow down the spread. Because every region that has done this is getting ahead of COVID-19. When we do this, we can put more resources to our healthcare system. And that's the reason we need to do this and move as quickly as possible.
But as far as why weren't you doing this ahead of time? What's to say you are getting the best medical advice? Because it took 4 hours yesterday for Dr. Williams to just switch from everything has to close, whereas earlier in the day it was stay open.
Well, I think I should let Dr. Williams answer that question.
When you asked yesterday, I said that we were in consultation with our federal government and we're across the country, each one reviewing whether we would switch to the 50 from the 250. Our stance before was consistently across that. We did have input as the day went on that we were all going to move in that direction and we want the Chief Public Health Officer in Canada. So again, as the Premier said, things have been changing, very fluid. We're trying to make sure we're in concert as best we can with our peers across the country to be consistent.
A question for Premier Ford. Yesterday when Trudeau announced the closure of the borders, he was heavily criticized for taking so long and dragging his feet in doing so. What is your message to, other provinces and regions that haven't gone to the extent that Ontario has at this point to do so, to follow in your footsteps?
Well, I'm in full communication with other premiers, and I just want to mention that every situation is different, every single province. I know the premier as well. They're going to make a decision based on the situation they're facing in the province.
With Ontario facing a deficit of billions, how are you finding this $300 million? Where's that money coming from?
Well, again, I've said right from day one, we'll spare no expense. Because we've been prudent fiscal managers for the last 18 months, that's what is allowing us to spend an additional $300 million. But we can't do this alone. We need support from the federal government, and we'll make sure that we take care of businesses and people in this province, but we do need the support of the federal government. And when you're a prudent fiscal manager with the taxpayers' money, you always have to make sure that you have enough funds for the rainy day that comes along. And because of the great work that our Minister of Finance has been doing, along with Treasury, our Cabinet and caucus, we're able to have some funds when those rainy days happen.
Just to be clear, do you know what the split is between the federal government and the province?
Right now, if you want to answer that, Minister.
Sure. This it reflects the $200 million as well that the federal government provided, as well as the $100 million that we spoke about last week. Obviously, as I talked about yesterday in our statement next week, we're going to be looking at money in 3 buckets to support healthcare and other related government services, to support people, and also in areas where we need to support jobs and the economy. So those are the categories. And we're in regular communication with the federal government to discuss about how exactly we want to work in a way.
This question is for the Premier. You had just mentioned that this has been changing by the hour. So what was the turning point for you yesterday or this morning to decide to declare the state of emergency?
Well, the advice from the Chief Medical Officer of Health. We're following the experts healthcare industry, following the advice of the Chief Medical Officer of Health, and that was based on that decision.
And also, you had mentioned that, so any sort of gatherings of 50 plus people, you're making it that is not to happen. But yet, you mentioned that, you know, office buildings could remain open. There are businesses that have 50% staff. So why wouldn't this apply to that?
Well, first of all, it's critical we keep the supply chain going. Absolutely critical. We need our grocery stores open. We need the manufacturers of goods to continue manufacturing, to get the products in the stores. But it's absolutely critical that we keep the supply chain going.
Good morning, Mr. Premier. You had mentioned that every region that takes similar steps that Ontario is taking today have gotten ahead of the virus. So which regions are you talking about? What makes them a good model to follow?
Well, a large country, and you're seeing the job they're doing. I think they're doing a good job. Mind you, their numbers are a lot higher, would be Korea. You know, they're doing their best, like all of us, to get ahead of this and flatten the curve, slow the spread. And when we do that, put more resources, the $300 million, into frontline healthcare, support them. That's what we need to do to try to get ahead of this.
Morning, Premier. I was wondering if you have any sense of how long this state of affairs will last, when you think Ontarians might be able to get back to their normal lives.
Well, we're doing everything we can, again, to slow the spread. And I'll be relying on the advice from the Chief Medical Officer of Health. That is our main goal. We don't want the spike. We want to flatten the curve, put more resources until we can handle any influx whatsoever. We have to be ready for every scenario, and that's what we're ready for.
Okay, and as a follow-up, it's not the Canadian way, as you mentioned, but are you prepared in case people do panic or, heaven forbid, there's looting?
Well, again, I have confidence in our police, and I just pray to God that wouldn't happen. We have incredible people. We have the smartest and brightest people in the world right here in Ontario. We need to stick together. We need to support each other. We need to look out for each other. If you have an elderly neighbor, take care of them. If you're going to the store, maybe ask them if you can pick up some groceries. But I have all the confidence in the people of Ontario. We're going to get through this together. We're going to work together, and we will get through this. So we're sitting on Thursday with the cooperation of the NDP and the Liberals and the Green. Hopefully we'll get through that in one day. But I want to be very clear. We're doing this to make sure that the bars and gatherings of over 50 don't happen. We have to slow down the spread of COVID-19. And really that's why we're doing it, Jamie.
Yeah, well.
That's the only way we can slow this down, and social distancing. Well, be it by law officers or police officers, but we shouldn't have to do that, Jamie. There's so many great business owners, and in some cases, when they close the restaurants, close the bars, not all cases, but they'll have access to their insurance that they have on their businesses. But we need to work together. Let's work together. We'll get through this. And I think the responsible business owner will not open up.
Okay, we'll go to the phone line now. Again, one question, one follow-up.
Your first question comes from Victoria Gibson from iPolitics. Please go ahead.
Good morning. My question is for the Premier. With the state of emergency, I'm wondering, would the province potentially be allowed to have out-of-province medical workers work here in Ontario without second college certification?
That was very hard to hear. I apologize. It's hard to hear on the line there. Maybe if someone could repeat that question. I think about taking medical professionals from other provinces.
Can you repeat the question?
Yeah. The question is for the Premier. With the state of emergency, can the province potentially allow out-of-province medical workers to work in Ontario without Ontario college certification?
Well, I'll pass that over to the Minister of Health.
That's not something that we're contemplating right now. The purpose of the emergency order really is to allow for the closure of the facilities that are noted in the order, childcare, licensed childcare facilities, private schools, bars and restaurants. That's what we're really focusing on right now. It may be something that we might need to consider in the future, but for right now, we're looking at limiting those kinds of activities to, as the Premier said, to flatten the curve and to prevent the spread of COVID-19.
Thank you. And in follow-up, will the declaration affect anything about supply? Will there be any limits on bulk buying that might be able to be enforced, for example?
No, it won't affect the supply chain.
Next question.
Your next question comes from Travis Donrosh from Global News. Please go ahead.
Morning, Premier. Italy right now is having to decide who will live and who will die due to lack of respirators and hospital capacity. The evidence shows that if you order everyone to stay home, the case numbers, and when the case numbers are low, you reduce transmission and reduce overload at hospitals. Why are you not ordering everyone to stay home now as opposed to waiting to do that?
Well, Travis, we aren't in the same situation as Italy. And secondly, I'm taking the advice of medical professionals. And the Chief Medical Officer of Health has not required us to do that. We aren't at that stage. But again, every scenario could pop up. And as I've mentioned over and over again, this is changing hour by hour, day by day.
And just as a follow-up to the Health Minister, can you say with confidence that Ontario will have enough hospital capacity and enough respirators if there's a spike quickly in cases like we have seen in, say, Washington State or New York City, for example, or New York State, for example?
Yes, we do have a plan in place. It is evolving rapidly, and we have the ability now with the additional funds to be able to create more bed space. We have respirators on hand. We have ordered more. But certainly what we're doing today with the announcement of this order is, as I said, to try and flatten the curve so that we don't end up with vast numbers of people in hospitals requiring respirators. This is the purpose of the order, so that we can protect people and keep them healthy.
Next question.
The next question is from Allison Jones from the Canadian Press. Please go ahead.
Hi, Premier. I'm wondering if you can talk a little bit about what you see as the economic impact of this order to close restaurants and bars, etc.
Well, there's thousands of people that work in bars and restaurants, and that's why it's essential the federal government gets moving on the EI, instant EI for people that have been laid off. We're there to support them. Our government will be there to support them, and we'll be there to support businesses as well.
And just follow up, can you clarify if this order applies to shopping malls as well?
Well, I'm going to pass that over to the Chief Medical Officer of Health.
The aspect in there, we've looked at that to consider, and because it is retail stores separate, we're watching to see how that will happen. We have not actually closed malls at this time. We're going to be advised by that situation to see if that's necessary, but we will be advised by different directors and our healthcare people in that regard.
Next question.
Your next question is from Rob Ferguson from Toronto Star. Please go ahead.
Good morning, Premier. Just wondering, what was the tipping point to declare these emergency powers today on things that Dr. Williams simply recommended yesterday? Were you seeing signs that some businesses were not complying? So what happened there?
Well, again, based on the advice of our Chief Medical Officer, We sat down with Cabinet late last night and early this morning, had an extremely good discussion back and forth, and we decided that's the best thing to do to protect the people of Ontario, to slow down the spread, to flatten the curve, and make sure that we have the resources for our healthcare workers to do the job and give them the tools they need.
Okay. As a follow-up, with these emergency powers you're declaring today, what kind of other powers does this give you, and what would be the tipping point for using those? For example, can you tell people that perhaps you don't want anyone else coming into Toronto? Can you tell people that they shouldn't be flying or taking the train in the province or public transit? Can you and closing down businesses?
Rob, right now, we're just focused on making sure that, as the minister said, bars, places of worship, any place that people gather, restaurants, we just want to make sure that we have social distancing to the best of our ability. But again, we need cooperation from the public, and I think the public is well aware of the situation, and I'm proud the way they've been handling this, and I'm very, very grateful for the people of Ontario and the way they've been reacting so far. They again are our partners along with the federal government. Where we need the support, and I'm seeing it in these communities, we'll be there, Queen's Park will be there, the federal government will be there, but we need the people. We need the communities right across this province, all 444 municipalities, to be working with us and making sure that we, again, slow the spread of COVID-19.
Next question.
The next question is from Sabrina Nanji from Queen's Park Today. Please go ahead.
Oh, hi, Premier. I'm just wondering, you mentioned that you want to support businesses. Will the relief package include compensation for businesses that will be forced to close?
Well, we're working along with the federal government right now. Our first package, we're focusing the $300 million on healthcare. We're working on other packages that will support small businesses and businesses across this province. But right now, we want to focus on our healthcare workers.
And do you mind maybe elaborating a little bit on what type of support you'll be providing to businesses?
So right now, the Minister of Finance is working with his federal colleague, and I'm sure that's going to be coming over the next few days.
Next question.
The next question is from Christina Horwan from City News. Please go ahead.
Hi, Premier. Good morning.
Hi.
I'm wondering if you're planning on changing the time of use right now for hydro rates, or if people can expect massive reductions in their hydro bills at this point.
Well, that's on the table. We had that discussion with the Minister of Energy with the time of use. I'll be very frank, I've never been in favor of that from day one, but the Minister of Energy is working on that, and we'll be talking about that over the next few days.
Safe travel. And then a follow-up now that might be better suited for Solicitor General Jones. What new measures are you planning on instituting in our correctional institutes? We're hearing a lot about a lack of PPE gear for staff there, but are you going to be stopping transfers? A lot of jail guards are saying that they simply don't feel like they are prepared for this sort of situation.
So I'm sure you caught the press release that we sent out Friday. We've already instituted a number of measures, things like people who are serving weekend sentences no longer have to go into the institution. We have put a number of protections in place, and we'll continue to do that to ensure the safety of our corrections officers and the inmates who serve.
But are you planning on stopping transfers to different institutions?
So as a general rule, because of some of the changes that have happened with the Attorney General, the court transfers are very much limited. There are some transfers that are happening in terms of releases, but I want to assure you that we have put a number of measures in place already, and will continue to assess the situation to see what additional procedures that we can put in place to protect individuals.
Next question.
The next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hello, Premier, and everyone else there. So yesterday, the federal health minister confirmed that the coronavirus is spreading in the community. How many cases are being investigated as community spread in Ontario right now? And judging from other cities like Italy, what would the actual number be? Because we know there would be so many more that we don't even know about yet.
Thank you for the question. I'm going to ask Dr. Williams to please join me to discuss this situation with respect to community spread.
So we are aware of each of our different health units as they obtain information on cases with positive testing. They undertake an investigation to see if they have risk factors such as travel or contact with a case. If they can't identify that, there's a question if it's community-based. Then you have to do further investigation of the close contacts of that person to see did they get it from some other source. So it does take more time to do that. So the ones that are not definitely addressed with risk factors are assumed it could be community, but it doesn't mean it's ruled out yet. Toronto has some of the other health units have one or two, and they're following up on those at this time. But the majority of our cases have been related to travel or with contact of cases.
Okay, but how many in total? As a follow-up, how many cases in total? You said Toronto has some. I believe the number yesterday was 3. How many in total do you believe are community spread, and therefore is the potential for that number to be far greater?
I haven't got the numbers yet for today. It changes day by day as they work through their investigations. Some are removed off and risk factors are identified. So we'll have to see what that total, including new cases being added every day and more of them to be followed up on. So it's a fluid number in there, and I am very proud of the work that they're doing to manage that very well and to keep that number down and to try and identify any risk factors or if there's any clustering that they would follow up on as appropriate to their protocols.
Are you concerned that the spread is far greater than we realize?
The methods we've done with our sentinel surveillance, we were concerned before to say, are we missing any? And so therefore any case that we've seen in our long-term care facilities of outbreak of respiratory or in our hospitals and emergency departments that are admitted for respiratory problems, we've done parallel testing. We've done nearly well over just about 2,000 tests, and they've all been negative so far. So if we were sensing a lot of that, we would start to see some of those showing evidence of that. So far, we've been reassured by that, but it doesn't mean we're going to be complacent.
Okay, we have time for 2 more. Next question.
The next question is a follow-up from Travis Dunrush of Global News. Please go ahead.
Hi there, Premier. This actually is a question for the Health Minister. Minister Elliott, yesterday BC's Health Minister didn't hold back, saying that he thought it was a mistake to close the border to every other country in the world other than the United States due to the outbreak that we are seeing there. I'm wondering if you can weigh in and whether or not you think it's a misstep not to close that border more quickly to reduce the amount of transmission coming from the United States.
Well, I can't really comment specifically on that because that's another decision that was made, but we are dealing with that. We are trying to make the best decisions for Ontario right now, which is why we've brought forward this emergency order, because it really is necessary to flatten the spread of COVID-19, and we want to make sure that to the extent possible with mass gatherings that they not be held, so that we can stop the spread of this virus and keep people safe and keep our hospitals from becoming overwhelmed.
And to Dr. Williams, I just have a clarification on my earlier question. Premier said that we're not at the point yet where they need to have a province-wide shutdown. At what point do you make that decision? Is there a case number that we have to reach? What's the threshold there before you recommend that?
All in our approach here in Ontario, we have continually emphasized that people coming forward and participating and taking part in this response has demonstrated the effectiveness of the Ontario program. Ontarians are concerned. They continue to do what they need to do, and they're taking action. And the information is that when you add social distancing protocols with your control mechanisms, your containment. The key thing is public participation. I think we have that in Ontario. We have people who are dedicated to that. They want to take part in that. And so I have confidence at this time we don't need those kind of aspects, because things that people do on their own volition, but dedication, as the Premier said, helping each other to manage the situation, because it is a collective action. And we can do this, and we can keep flattening the curve on COVID-19 and on that aspect there. So I really emphasize the participation ongoing of our Ontario citizens.
Okay, one last question from Antonella.
We're getting very worried emails from people like artists, the self-employed, people who have small shops like hairdressers, who need that monthly income to meet all their expenses. I know you can't provide perhaps every detail right now, but can you assure that these people, they're not being forgotten in this, that these sort of small employers, independent artists will be covered in whatever protection measures or supports you offer?
We will, with conjunction with the federal government. Again, it's absolutely critical we partner with the federal government, especially the self-employed, that EI is not available for them. And I just want to mention, we won't forget those people. We aren't going to forget anyone. We're going to spare no expense to take care of the people's health and personal businesses across this project with the support, I emphasize, with the support of the federal government. Thank you, everyone.
Thank you.
Thank you. Appreciate it.
You need something?
Now what?
Invoking a state of emergency, and where is the government going to find all the money to pay for all the measures that you're going to have to roll out over the next little while?
State of emergency isn't necessarily something in itself. It is a way of enacting measures that otherwise would not be able to be enacted. So we are looking at the Emergency Act to look at what those measures are that it would make available, and whether there are other ways without having to bring in a state of emergency that we could invoke them. We are examining that very carefully. And on the costs of the measures, Canada has taken responsible fiscal decisions over the past years that have allowed us to have a significant room to maneuver on investing in our economy. We are the G7 country with the lowest debt to GDP ratio, the lowest debt as a proportion, deficit as a debt as a proportion of the size of our economy, and that allows us to invest significantly in Canadians, in businesses, to make sure we're able to make it through this difficult time and make sure we continue to prosper and grow once we are through this moment. That is the result of the decisions we have taken responsibly as a government over the past years.
We'll now go to a few questions on the phone. Just one question, no follow-up.
Thank you. We will take questions from the telephone lines. On va entendre les questions du téléphone. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1 maintenant. The first question is from Mary Walsh from the Globe and Mail. Please go ahead. À vous la parole.
You need something?
Hi, Prime Minister. Canadians are getting very different messages from the provinces and from you and from cities. They're varying from stay with gatherings under 10 people to 50 people. And I'm wondering if you are worried that Canadians are getting mixed messages.
From all governments is very, very similar. Stay at home as much as you possibly can. Engage in social distancing. Look to care for your loved ones and don't go out unless you absolutely have to. The various recommendations will be suitable to various jurisdictions, but we are coordinating very closely across jurisdictions to ensure that Canadians get this message that it's time to stay home as much as possible.
Thank you. Merci. The next question, la prochaine question est de Hélène Buzetti du Devoir. À vous la parole. Please go ahead.
Oui, bonjour, Monsieur le Premier ministre.
Hello, Prime Minister. I'd like to pick up on the question of the American border. You said that you didn't take a decision right away to not compromise supply chains. But what's the actual link between tourism and freight? Why would stopping tourists crossing the border actually impede trade? Because this really gives the impression that you're doing what Donald Trump wants you to do. Not at all. We're coordinating with the American authorities because we have a very high level of integration in our supply chains and our economic ties as well. We'll always take steps which are the right ones for Canadians. We'll look carefully at what has to be done, what next steps have to be made. We've taken the necessary steps at every stage, and we'll continue to announce the necessary measures as science and recommendations from our experts change. Thank you very much. Thank you very much.
All right, Peter Van
You just
Dusen
heard Prime
listening
Minister
along with
Justin
you.
Trudeau addressing the nation and taking questions from reporters on this COVID-19 pandemic. He's been in self-isolation ever since his wife was diagnosed with the new coronavirus. Let's bring in Global's Mike Armstrong, who's been monitoring this news conference. Mike, the tone was that we should stay home, that we should social distance. Why did he not declare a national state of emergency yet?
Well, he said that that's something that they're looking at. There's going to be a full cabinet meeting this afternoon. He said they're considering recalling Parliament to pass emergency legislative measures, things to do around EI, ways to help Canadians. But they are, as you said, examining the Emergency Measures Act to determine if they need to enact it right now to do things that they can't do in other ways. So that is something that's still on the table.
His tone was that he didn't want to create panic. That's the sense that you get from that. But we don't want to burden the healthcare system either.
It sounded like he was trying to rally Canadians to say, this is your duty. He started out by talking about how grateful Canadians are to everyone from doctors and nurses to the cleaning staff in hospitals. Also thanked retired healthcare workers that have come back. But he said Canadians have to help them out. Don't gather in groups, cough into your arm, wash your hands often, practice social distancing. And these are measures that he said will help the healthcare system. And it's everyone's duty. As much as possible, don't go out, stay home, work from home if you can. things will get better. The government's trying to flatten the curve. One measure he announced today is that as of Wednesday, all national parks and heritage sites will be closed. And he again talked about those emergency loans that are being put out there to help Canadians who are outside the country come back if they're having financial trouble doing so. And that money would also help them if they're stuck and can't get back.
There were a couple of questions about why isn't there a directive nationally to close restaurants, bars, etc., because provinces and cities are basically taking their own initiatives. What was his answer to that?
Well, he sort of talked about how there are a lot of things that are in provincial jurisdictions. There's no big template. They're in constant contact with the provinces. And so there isn't one way of doing things. I think everything that he's announcing even today could change tomorrow. So that is something that could come.
All right, Mike Armstrong in Ottawa. Let's go to Toronto now, and Camille Karamali, who is outside the Ontario legislature, where the Premier just announced a state of emergency in that province. Let's be clear, though, that the province is not shutting down. So what does that entail?
Yeah, that's very right. And he wanted to make that absolutely clear, articulating that several times, that the province of Ontario is not shutting down. These measures, this state of emergency, is really to deter any groups of 50 or more people from gathering and congregating in one place. He said it was a very difficult decision, and Premier Ford also said he had to consult with his counterparts before making the decision, a very difficult one once again. So that means that several parts of the city are closed, including all recreational programs, libraries, private schools are all under that umbrella, including churches and other faith settings and daycares as well. Very important for parents there to know that. What is open, though, and this goes all with him saying that the province is not shutting down, is public transit is open, grocery stores, convenience stores, pharmacies, most importantly. But what's also going back to the closed list, Robin, is bars and restaurants, because what he does say is that you are allowed takeout and you are allowed to go through the drive-through, but sitting down is no longer allowed. They're asking all restaurants to eliminate the public seating option, is how they're phrasing it. And going back once again to what is open, most people are asking about this, so we'll answer your question. The LCBO, the beer store, and the cannabis store also remain open. Now, Ford also announced a $300 million aid package. That was also a pretty important staple point that he wanted to get across, because there have been several complaints from nurses and doctors about a lack of resources. So that money would go towards hospital beds, as well as resources, gloves, masks for doctors and nurses, frontline healthcare workers. Robin, I'll send it back over to you.
All right, thanks for that, Camille. We can also tell you that Ontario has reported its first death due to the new coronavirus. Of course, we'll have more details coming up tonight on Global National. And for all other breaking news, be sure to go to globalnews.ca. I'm Robin Gill. Thank you for watching.
This has been a special report from
Check 1 2 3 4 5 6 7 8 9 10. I'll go with the French interpretation right away just to make sure.
A very simple solution. We want to get rid of it. We want to have as few deaths as possible. This is a horrible thing. You look at what's going on with Italy. We don't want to be in a position like that, but a much larger, because we're a much larger country. We don't want to be there. And I think we've done really well. I think we've done well. I think the states have done well. We're all working together. The best thing we can do is get rid of the virus. Once that's gone, it's going to pop back like nobody's ever seen before. That's my opinion, but I think it'll pop back like nobody's ever seen before. Please.
Just to follow up on John's question, specifically how many new hospital facilities could the Army Corps of Engineers build? And also, what specific measures are you taking to try to increase the number of ventilators in the stockpile?
Right, we've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment, but compared to what we're talking about here, this has never been done before. And yesterday I gave the governors the right to go order directly if they want, if they feel they can do it faster than going through the federal government. Now, we've knocked out all of the bureaucracy. It's very direct, but it's still always faster to order directly. And I gave them, that was totally misinterpreted by the New York Times on purpose, unfortunately. But it's very important. Yes, ma'am. Yeah, please.
The President directed us to work with the Department of Defense. There's two ways that DoD can be helpful in terms of expanding medical capacity. I know the Governor of New York has asked us to look at the Army Corps of Engineers, which could perhaps renovate existing buildings. But the President also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly. We spoke with Governor Inslee yesterday in Washington State. We have resources in that part of the country that we could move. And as governors make these requests, we will process them, bring them to the President. But there are two different lanes that DoD can provide, in addition to many medical supplies to augment our national reserves. And the President has tasked us to evaluate, make available, and to consider every request from governors for either field hospitals, expanding facilities, or the Army Corps of Engineers that could retrofit existing buildings.
The Army Corps is very prepared to do, as we say, and we're looking at where it's going. But and they do call them MASH hospitals, but the field hospitals go up very quickly. We have them. We have all of this equipment in stock, and we're looking at different sites in a few different locations. And we're not going to need them in West Virginia, where so far I guess they have none. Still none? Still none, right? West Virginia. Big Jim, the governor's, he must be doing a good job. That's what's reported.
Is that a reporting issue, or is that they have no cases?
Well, that's all that, I just see West Virginia is the only one that has no cases. So obviously that's being treated differently than in New York or California, different parts of California. I do say this, though, the Army Corps of Engineers is ready, willing, and able. We have to give them the go-ahead if we find that it's going to be necessary. We think we can have quite a few units up very rapidly. I'm going to work with Governor Cuomo. I'm going to work with a number of the governors. Governor Newsom has been very generous in his words, and I'm being generous to him too, because we're all working together very well. And I think a lot of very positive things have taken place. We're talking to California about different sites, but we can have a lot of units up fairly quickly if we think we need them. I think what I'll do is I might ask Seema to say a few words on the telehealth, and then we can get back to this, please. Seema?
Thank you, Mr. President. And as the President announced earlier, we are doing a dramatic expansion of what's known as telehealth for our 62 million Medicare beneficiaries who are amongst the most vulnerable to the coronavirus. And we're acting in accord with the appropriations bill that was signed on March 6th, as well as the President's emergency declaration last week. And this action is a part of our broader effort to ensure that government requirements, rules, and regulations don't get in the way of patient care during an emergency. And today's announcement builds on the significant progress that the President has already made over the past 3 years around telehealth services. And while we have allowed for virtual check-ins, full telehealth benefits have been restricted to those living in rural areas, established patients, and just for those brief visits. But no longer, Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home. And these services can also be provided in a variety of settings, including nursing homes, hospital outpatient departments, and more. And thanks to the leadership of HHS, we'll also be temporarily relaxing certain HIPAA requirements so that doctors can provide telehealth with their own phones, and we'll be using enforcement discretion when it comes to collecting copays so that cost won't be a barrier. This is a part of our larger efforts around mitigation, and as we are encouraging Americans to stay home whenever possible, we don't want our Medicare policies getting in the way. And so consider the implications of this. Perhaps an elderly patient with diabetes needs routine checkup, and this has nothing to do with the coronavirus. And so with our new telehealth benefits, this person who's not really, who's at risk for the coronavirus doesn't have to venture outside their home. They can talk to their doctor via Skype, and they don't have to risk exposure to the virus, and they can receive that care from the safety of their own home. It could be another Medicare recipient who's experiencing mild flu-like symptoms, and instead of leaving the house and sitting in a waiting room full of other vulnerable people, they can also receive advice from their doctor from their home. And this shift is very important for clinicians and providers who over the coming weeks will face considerable strain on their time and resources. And now Medicare patients who don't absolutely need to come in to an office won't have to. And this allows the healthcare system to prioritize for care for those that are that have more needs or in dire need, and preserves protective equipment as well. State Medicaid agencies can also provide telehealth services without federal approval, and so we're asking all states to make this available as well. And we've also asked private insurance companies to expand their telehealth benefits and make it clear to their providers and their members what they cover. As our nation seeks to balance the twin imperatives of getting Americans the care that they need during this outbreak and limiting the spread of the virus, the impact of this historic action simply cannot be overstated. In an emergency, those on the front line shouldn't have to worry about federal rules and red tape, hamstringing them when they need flexibility above all else. And we're doing everything in our power to make sure that that doesn't happen. I also just want to briefly mention that because of the President's emergency declaration, we do have the ability to provide a lot of Medicaid waivers, and Florida was the first state to be approved. We were able to do that in a matter of days. Thank you.
Any questions, please?
Where do senior citizens go for instructions on how to do the telehealth?
They should call their doctor's office, and their doctor's office can tell them how to do that. Also, there may be some of our Medicare members that may not have access to equipment, so we're asking family members to help with this, but also respecting the requirements around social distancing, and if any of those family members or neighbors have symptoms, they should obviously stay away.
Will you be posting numbers also?
That's correct,
That might
exactly.
be the easiest way to do it.
Yes.
If you post in ads, if you post some numbers.
And they can also call our 1-800 Medicare number, and they can also get information. Those phone lines are open.
Thank you. Admiral, if you'd say a few words about where we're going, and then I'd like to ask Dr. Brooks to say a couple of words.
Need help?
How the system's working.
Well, thank you very much. As we talked about earlier this week, the commercial system is rapidly advancing in the testing capabilities. As of today, our public health laboratories, meaning the CDC and the public health labs, have reported out 31,878 tests, so almost 32,000 tests. The clinical laboratories, the Association of Clinical Laboratories, have reported out about 27,000 tests, and most importantly, of those 27,000 during the cumulative period of time, 8,200 of them were yesterday. This is showing the dramatic ramp as the high throughput comes in. We don't have the numbers this morning from the American Hospital Association, which means all the individual hospital laboratories. We will have that upcoming in the next day or so, and then Ambassador Birx will have this whole process fixed with the legislation that everything will roll up into a common reporting probably by the end of next week. In terms of our drive-through laboratories, again, these are blossoming all over the country by individual states. The ones that we are heavily involved in and really pushing equipment to, we expect over the next few days to begin setting up 47 of these in approximately 12 states. The material is already palletized and being shipped to the locations. Most cities have the specific locations. Some do not, but it's still going to a central receiving. And we know that we'll be deploying at least 140 Commissioned Corps officers. About half of the sites have reported their requirements. About 140 officers will be going. We expect that to go up. So this is going on the way we expected. We did a trial site yesterday with a full mobile unit for drive-through with full PPE. We had a lot of kinks in the system, as you can expect. That's why we do a test before we go out into the field. Don't expect these to be 100% perfect the moment they come. They're going to be adapted to the state and the local situation, but we're very confident that these will add testing to the already very robust healthcare system and commercial system. Thank you, Mr. President.
Thank you, Admiral. And this has never been done before, and it sets a great roadmap for future. Should we have something like this in the future? I hope we don't. But it's never been done before, and they've done an incredible job. And again, we're working with the states and relying on the states. We have to, because they have, it's point of sale, it's point of sight, and we're in, I think, just about every instance getting along really well with the states. If I could, Dr. Birx, if you could say a couple of words, please.
Great, thank you. Thank you, Mr. President.
So I think what you've been hearing from us is to find solutions that are high quality and sustainable based on the frontline workers and governors' requests. And those come in on the governor's call. We've been immediately responsive to those. And that's the level of red tape and bureaucracy that we have removed. I think that point about sustainability and quality is very important because, as the president says, we're creating a roadmap for a different level of functionality for future pandemics. Our flu pandemic preparedness plan was a plan. Now we're seeing where we have to revise, where we have to create new avenues of research, new avenues of work to really ensure that the need of the American people can be reached. We were adamant about having a high-quality test based on our commercial vendors. Over the next few months, you will begin to see that other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives. These tests were studied and studied by the FDA to really ensure that they are that level of quality, and we've given the states the permission to ensure that same level of quality. Now, I want to just say 1 minute on the testing. Testing should not be used as an assessment of your risk. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between, to really ensure that you're following these guidelines. We hear every night of people who are not in work, moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. So every single generation has a role to play. We're asking our older generation to stay in their homes. And we're asking the younger generations to support them in social contacting through videos and other Skype-type functions, or just the simple telephone. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts. I heard an innovation last night and this morning again on the news. I really want to applaud the private sector who are now creating senior-only shopping times. I think that's extraordinary. I think that shows what America brings, and I think other countries will learn from us about how to really protect seniors in this type of way. I'm hoping that carries through to next year when we have our flu epidemic, where we can really have a very different profile of the amount of mortality that we have during flu that we never talk about. Anywhere from 15,000 to 45,000 individuals are lost every year. If we learn how to do this well and sustain some of those core changes, we can change the way respiratory viruses, not only for this, but the future, affect Americans.
It's a big thing.
Doctor, maybe a couple of questions. Yeah, so a question on the clinical data. So we've had now roughly 5,000 people test positive. We've had 90 deaths or so. When are we going to know the data of who those people are? Who has been infected, what the ages are, what the pre-existing conditions are, how serious it was, both for those who have been tested positive, but also those who have died?
Well, you are singing my sheet of music. I'm very data-oriented, so thank you for bringing up this issue of data. I really want to applaud HHS. We had a discussion about this several days ago. They've made calls into Seattle and California to really understand that, and also importantly to understand how many of their patients needed ventilators, how many of them needed oxygen support, how many of them needed and what they needed. Could we predict early someone who was going to have a more difficult course? These are all the questions we're asking and answering right now. We did get an early report back from Santa Clara and Seattle. We're digesting it. We just got it this morning. We're looking at that carefully because we think that roadmap is very important to other communities. We have not discussed this with New York yet. We do know from other countries, and that all is available online, that profile. You can see that mortality under 30 is extraordinarily low. The mortality across the board outside of Wuhan is now settling somewhere around 0.7, but that should not be reassuring because it's much higher in people with pre-existing medical conditions, even if young, and people that are older with pre-existing medical conditions. And so we still want every American focused on doing what they can do today to change the course of this pandemic.
Will you commit to making that data public so we will all know?
We're committed not only to making it public, but to have a website that everyone can see in real time.
Dr. Birx, if I could just follow up. You all are signaling a much more aggressive posture toward containment mitigation now. And many states have been very aggressive. But there is a small number of states that have not issued public guidance to their residents. Is it important for the success of the effort that 100% of the states be forward-leaning on this? And if so, Mr. President, what would be your message to those states that have not? Okay.
So that's why the Vice President and the President yesterday issued those critical guidelines. As I said this morning on Fox and Friends, you can look at them as guidelines, you can look at them as requirements, and you can look at them as the President asking every American in every state to follow those. That's why we put them out at the federal level. We wanted to make sure every American knew what they could do today to change the course of this epidemic. I think it's empowering. I think it says all of us have a social responsibility to each other, and that's why we believe that every mayor and every governor should be instituting these guidelines that came from the White House and the President of the United States.
And we've been very tough in those states. I know exactly what you're talking about. We've been very tough in them. Thank you. Please, go ahead.
A follow-up question on the testing. You've been telling us for days now that millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just at 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology, push out those tests. Because we can only make them available, groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for orders.
And is that where the issue is, getting the tests out, or is it getting the tests conducted?
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the issues related to getting the test conducted. Obviously, that does take time. He is working on innovative solutions that are creative and sustainable, that will be a game changer in testing, but we don't have the data yet. This is a critical comparator. Can you do it yourself? Can you actually sample yourself? These are the kinds of things we're working on right now, and he's getting the data for us.
And the states are actually doing a lot of it. The governors and the states are doing a lot of it, with even our tests. Yeah, go ahead. Go ahead, please.
Okay, thank you. Can you give us a sense of how long these tough new restrictions will need to be in place until we start to see the rate of this virus going down? And also, can you speak to this study that as many as 2.2 million people in the United States could die if there weren't this type of action by the government taken? To what extent did that prompt what we saw yesterday?
I think, models are models, and they're based on input, and they're based on infectiousness without any controls. I can tell you we've never seen that level of infections that modeled up to that 2.2 million in mortality. So we are looking at that. We are having a particularly model meeting tomorrow. I think that's really going to be important. I've dealt with a lot of modelers in my time. They're wonderful people. But they all have their favorite inputs and they all have their favorite integration functions. So we're evaluating all of those so we can integrate and create the best model for the United States based on the best data. And that first set of recommendations you saw were based on what we could do today to prevent anything that looks like that. If I could just say one other thing to the hospitals and dentists out there. Things that don't need to be done over the next 2 weeks, don't get it done. If you're a person with an elective surgery, you don't want to go into a hospital right now. There's a lot of distraction. There's a lot of people doing a lot of other things to save people's lives. So let's all be responsible and cancel things that we can cancel to really free up hospital beds and space. And then let's do everything that we can to ensure that we don't need the ventilators because we protected the people who would have needed to use them.
And are you looking at the possibility of more actions like, for example, limiting travel within the United States? Are you looking
It's possible. It's possible. We'll see how it goes. I think a lot of There's been great cooperation with local governments, states. We'll see how it goes. It's going right now pretty well. Yeah, please, go
Can I
ahead.
follow on that, Mr. President,
Please,
very quickly?
yeah.
Just very
Go
quickly.
ahead.
Do you need to invoke the Defense Production Act to get more of those medical supplies to different
Well,
hospitals?
we're able to do that, and we have to. Right now, we haven't had to, but it's certainly ready. If I want it, we can do it very quickly. We've studied it very closely over 2 weeks ago, actually. We'll make that decision pretty quickly if we need it. We hope we don't need it. It's a big step.
More help from the federal government
Well,
when it comes to those supplies.
You know, when you
What
say
do
the states,
to those governors?
in particular, 3 states need some help, and some states, you know, have 2 people, 3 people, no people. In the case of, again, West Virginia. So we're looking at it very closely. We've taken it apart 15 different ways. It's a very difficult thing to do. It's a very big step, and if we need that step, we'll take it. Okay?
First question. I think a lot of people are going to travel to places that aren't considered hotspots, the Caribbean, Mexico, that sort of thing over the next few weeks. Would you recommend that they follow through with those plans?
I would just say enjoy your home stay. I would just say right now. We have to get this problem fixed, and then we'll get back into business really quick. We'll open up our country, we'll open up our society, the world will hopefully open up. We see areas of the world that haven't done well, and we see areas that are doing very well. And I would put us in the category of doing very well for a country so big. I think that I would recommend that they just enjoy their living room. John? Yeah, go ahead, please.
What do you say to people who are not heeding these guidelines from the White House? And then also I have a question on asymptomatic people,
sure.
Dr. Burks.
I'm not happy with those people if they're not. But you know, those people are being shouted down by other people. They know it. They're being, it's almost like self-policing. People went in, there were a couple of instances, I guess, probably more than a couple, where people are not happy when they see others doing what they're not supposed to be doing. We have to get rid of this. We have to win this war, and ideally quickly. Because the longer it takes, it's not a good situation. And I'm not even talking about the economy. I'm talking about the lives of a lot of people. Yeah, please. Did you have one?
Will the White House put any restrictions on corporate bonuses for companies that do get bailed out, like airlines?
I'm going to ask, I think I'm going to ask Mike, answer that question.
I think it's all a work in progress. What President Trump has made clear to industries around the country is that we're going to do whatever it takes. We understand this is an extraordinary moment in the life of our nation. It's the reason why the President brought in leaders in the financial sector, airline industry, but we could all additional industry leaders today in tourism and hospitality. He has tasked the Secretary of the Treasury to work with members of Congress in both parties to make sure that we construct the kind of economic support that will allow those industries to weather the period of the coronavirus and then to come back stronger than ever before.
We've had such incredible, I don't know, it's almost the word spirit is the best word. It's like a spirit. The banks have come in, and the banks are doing things that they would have never done. They're working on extensions and lots of things that they wouldn't have done. Co-pays with regard to the insurance companies. I mean, for them to be doing what they're doing, you know all about the co-pays. They would have never done that, and they did it. They were in my office. They, I would say, the 11 biggest in this country. I guess probably the 11 biggest in the world, the big ones, all the big ones, and they did things on copay that nobody would be doing, that they wouldn't have done in a million years, but they're doing it. There's a great spirit going on right now in the country. So you want to, yes, please.
Dr. Fauci, you've said you like being accused of overreacting because that is an indication we may be doing things necessary to beat this, bend the curve. How long do you think it will take for you to be confident that yes, we're bending the curve, or no, we're not?
You know, I can't give you a firm number on that because the dynamics of outbreaks in some respects are predictable historically. They do this and that. We don't know because this is really unprecedented. I mean, of all the outbreaks that I've been involved with over the last at least 36 years and then going historically back, we've never had a situation where the mobilization of all the different components, travel restrictions, internal containment, mitigation, financial assistance, public health assistance, testing. So we don't really know. But the one thing I do know I do know that if you look at models with all of their vicissitudes of models, is that when you have input into the kinds of mitigations and things that we're doing, we're going to see a hump instead of a peak. I would be really surprised if all the things that we're doing, and this is really a comprehensive approach. I was struck as I was listening to everyone make their presentations that, I'm a scientist, I'm a health person, and I'm a physician who sees patients. So I look at it from one particular standpoint. But what I'm being impressed by is that this is really a comprehensive thing that has multiple components to it. All of them got to succeed if we're going to get to that end point that I've described multiple times from this podium. So I hope that if everyone does their job, we're going to be able to give you a number and say, we've seen that inflection and we're coming down. I would hesitate to do it now, to be honest with you, because it might be misleading, and I don't want to be misleading. I just want to say one other thing, because I heard Dr. Burke say it, and I think we need to say it over and over again. When I was young, a long time ago, I felt that I was invulnerable, the way I think many of us feel we're invulnerable. And when we're asking the young people to help us with this mitigation strategy by staying out of the bars, staying out of the restaurants, really trying to distance yourself, don't get the attitude, well, I'm young, I'm invulnerable. You are, well, in some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating. Please cooperate with us. Thank you.
Dr. Fauci, and I'm going to read my notes so I get this right, but there's apparently a new study out of China. It found that the vast majority of cases, 86%, were in untested patients with mild to no symptoms. So what does that say about the impact of testing? Does it mean that testing should actually be more on these patients?
That question keeps coming up, and I'm not going to evade the question, but I want to make a point. We tend to think that we're not going to be able to mitigate or contain without testing. They complement each other in some respects, but they're separate channels. Even if we had no testing, we should be doing what we're doing now. The question you're asking, so I won't evade it specifically, would it be important outside of a doctor-patient coming in together of knowing what's out there, what might be under the radar screen? The answer to your question is yes. So let me tell you what the CDC is doing right now. They're going out there, and part of their program is to get a feel for what is there that wasn't initially thought to be coronavirus, that was thought to be something else. When you do that, you're also going to get a feel of what the penetrance is in society. So we are heading with the high throughput things that you've been hearing about to get an answer to your question.
Governor Cuomo said this morning he believes that we'll see a peak in terms of infection in 45 days. Would you concur with that?
It's possible. I mean, I know that the governor has been really, I believe, doing a really good job of trying to stay ahead of this. 45 days is not unreasonable. You have to be careful. When you get a number, you own the number, and then if the number doesn't come out, you're in trouble. And that's the reason why, from our standpoint, from the federal government, we're talking about a range. So within that range, I mean, it isn't like you want to be correct for the sake of being correct, but you don't want to be wed to something and then have to back off.
Go ahead, please.
When is the soonest that we'll know that these new guidelines are actually bending the curve, actually working? And is there a point in time where in the next couple of weeks, where you'll be able to tell the president more draconian measures are needed?
Well, okay, so what's happening, I mean, if you look as a metaphor, it's kind of like a race against the virus. If left to its own devices, will do this. And us trying to somehow blunt that. Now, you could see the virus going up and up, and your effect, your work, what you're trying to do, may actually be having an effect, but you may not see it because it'll still be going up. And as you're trying to implement your interference with the virus, you may not realize that you are actually interfering. And you'll say, wait a minute, it's still going up. What's going on? You've done nothing. but you don't know whether it would do this versus that. So the answer to your question, it probably would be several weeks and maybe longer before we know whether we're having an effect. It may be at the end of the day, we'll see a curve that would have been way, way up. But I wouldn't put us to task every few days. Well, wait a minute, it's going up. Is it working or not? That would be really misleading if we do that.
Go ahead.
Guidelines which were announced yesterday. One of those guidelines was a recommendation against gatherings of 10 or more people. And today, the governor of Alabama issued her own guidelines, and it was a recommendation against gatherings of 25 or more people. What is your recommendation for people of Alabama, people across all of the country, as far as the guidelines that were announced yesterday by the federal government?
Okay, so the one thing we don't want to do is to get hung up on the difference between 10 and 25. I think you might agree with that. When we give guidelines, they're only guidelines. We sit down, we look at the data, as Dr. Burke said, we're data-driven, and we say, on different models, 10 looks good. If someone wants to do 25, we're not going to fault them, but if someone wants to come to us and ask us what we think the best is, we stand by the numbers. It isn't perfect, it isn't precise math, it's assumptions and it's data that make you get your decision.
Would it be more effective if every state and every city in the country was playing by the same rules
Yes,
instead of
of course. But this is the United States of America. There's a lot of free enterprise there. People do their own thing. And quite frankly, I don't think there's a big deal difference between 10 and 25. We got many, many more important things to worry about than that difference.
Mr. President, thank you. Going back to supply chains and then talking about preparedness for the future, yesterday Larry Kudlow said that there's an idea floating around the administration to cut taxes for companies who would be bringing their supply chains back to the United States. He said he specifically liked immediate 100% write-offs for structures, equipment, but he said you hadn't endorsed that yet. Would you endorse an idea like that?
We're looking at many ideas. That's one of them, frankly. We're looking at creating incentives for companies, not only that type of company, but other companies. We're also looking to help companies such as the airline industry within the airline industry, and we'll be doing that. We will be doing that. This is not their fault. And they've been very understanding, actually, and we're going to be helping them. We will have a very powerful airline industry, and it'll start up as soon as this is over. We'll have those planes ready to go. So we have to help them during the short term. It's very important. Yeah, please.
Thank you, Mr. President. I wanted to know, have you taken a look at some of these models, such as the Imperial College London model, that kind of poses a very difficult choice, whether it's shutting down society or overwhelming the healthcare system? Is that something that
We've looked at every model. We've relied on the very talented people, and there's no better team than the people behind me. And I will say that all of the people that have done those models are all in constant touch with Dr. Burks and Tony and everybody that you've been hearing so much from over the last couple of weeks. We've looked at many different models, and the model we have is we want to save a lot of lives. We want to save a lot of lives. If we get too steep on that curve, you're going to lose a lot of lives, perhaps unnecessarily. Now, we're going to find out. If everything has a risk, we're going to see. But if people do what we're telling them to do, what we're asking them to do, you're going to see the saving of a lot of lives. Now, Boris, in UK yesterday, you saw what happened. It looked like they were going a different way, but then he went away of similar, I guess similar, I don't know exactly, but I would say we had a conversation yesterday similar to what we're doing. So a lot of people seem to think this is going to be, we are looking to save the maximum number of lives. Everything else is going to come back. Our life is never going to come back. But everything else, our economy is going to come roaring back. You're going to know, we're going to know, we're going to all know that day. Somebody was asking about the day. When will you know? When will you know? We're going to know. All of a sudden, we're going to say, wow, that's looking good, that's looking good, that's looking good. And we're going to be on the other side of the curve. And that's a day that we look forward to, okay?
Sir, that you saw this week, though, that made you decide that, yes, now is the time to implement these much more stringent social distancing measures?
No, I don't think so. This is where we were going. I really think from the beginning, this is where we were going. This is what we had in mind. We're just going step by step. That was the next step, the next logical step. As Dr. Fauci said, and I think very importantly, One of the most important things when you write the history of this was the fact that we closed it down to China and Europe, but in particular China. We closed it down to China, the source, very, very early, very, very early, far earlier than even the great professionals wanted to do. And I think in the end, that's going to be, that will have saved a tremendous number of lives.
One on the economy and the other on the broader picture here, but just to follow up on my colleague, some people did note that your tone seemed more somber yesterday. You talked about an August timeline. Did you see a projection? Some people thought perhaps that 2 million people that could die prompted part of that. Was there a shift in tone?
I didn't think, I mean, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
Your former economic advisor said almost 100% chance of a recession. Do you see it that way?
It could be. I mean, I don't think in terms of recession. I think in terms of getting it out because when we're finished with the virus, we will win. We will win. And when that victory takes place, our economy is going to go through the roof. It is so pent up. It is so built up. It is so ready to go in an upward direction. But we have to knock out this enemy. This is a really tough enemy, but we have to knock out all of us. That's all of us. So I don't think in terms of recession, not recession. It's words. We have to knock out this, and we will have an economy. I actually think we'll have an economy like we've never had before. It's all pent up. Did you have something to say, Mike? Yes.
I think the question about the actions that the president's authorized, beginning in January, when he took the unprecedented step of suspending our travel from China. The efforts to issue travel advisories for portions of Italy and South Korea and then to begin screening out the passengers. The efforts regarding suspending travel for Europe and what went into effect at midnight last night, adding the UK and Ireland to that, have all been informed by the experts that are surrounding us. What the President's asked us to do from the very beginning, as Dr. Birx and Dr. Fauci often say, is let's follow the data, bring the President the best options in response to what is actually happening on the ground. But with regard to yesterday's 15-day slow the spread plan, our team unanimously brought to the President these very strong recommendations for every American, because we truly believe we are at a point in this epidemic in our country when we can reduce the number of people that actually are exposed to or contract the coronavirus. But we'll continue to bring the best data, the best evidence, and the best recommendations, frankly, of the best health experts in the world, and the President will continue to make decisions that put the health of America first.
In other words, reduce the number of people that die. That's what we're trying to do. And when you do the steep curve, a lot of people are going to die. A lot of people. You know, the worst ever, they say, 1918. And I don't have to go into the numbers, but they were unbelievable numbers. Had they known and had they done what we had now, it would have been a very much different story. It would still be tragic, but it would have been a very much different. But that was the one that people write about. That was an incredible pandemic, like we haven't seen. But we have done something that I hope. Hopefully, we will all have made the right moves. We're all in this together, including you, and we want to see fair press. And I tell you what, it's been, generally speaking, I think it's been a great thing to see. It's been very, very, getting along with Democrats, getting along with Republicans, for the Democrats themselves. There's been a lot of spirit. There's been a lot of things happening that I haven't seen happen in the first almost now 3.5 years. It's been very nice to see. That's one of the good things. But what really the good thing is we have to knock it out. We have to win. And we want to keep that slope as low as possible because that's a lot of lives in there. Let's go back there for somebody that didn't get one, please. Go ahead.
Mr. President, this has had a huge impact on China's economy as well. Have you received any indication from officials there that they're going to have trouble meeting the purchase agreements, part of the phase 1 deal, particularly the agricultural buy?
Well, they need our product very badly, and no, I haven't received any. We have good relationship with China. I have not received anything to that. No, we have a signed agreement. They're going to be buying, and they have been buying a lot of product. Yeah, please.
Earlier today, Dr. Birx was talking about the possibility of our hospital system being overburdened, overtaxed, and she talked about certain options that are available to the United States
Sure.
if that happens, including VA hospitals,
Right.
Department of Defense medical treatment facilities, and even hospital ships. At what point do you tap into those options?
Well, I'll know the point, and by speaking with Governor Cuomo and other governors, we're going to know the points. It's going to be different for New York than it's going to be from, Iowa, or from Idaho, or from West Virginia, frankly, or it's different. New York has got a big problem. The state of Washington has a big problem. California has some big problems. Everyone's doing a good job, but we're going to know when it will be, and I believe it'll be more spot than it will be. It's not going to be the whole thing. It's going to be spots. There are some hot spots that are in trouble, big trouble. Be careful. And there are other areas that are in no trouble at all. They watch it on television. They don't know. It's just not affecting them, and they're lucky. They're lucky, but there are areas of the country that don't have much of a problem, and some that don't have any problem. They're not going to have a problem with hospitals, but some areas like New York, California, state of Washington, they're going to have some difficulty. And when we see that coming, we're going to be in there. We're already making preparation for it.
Senator Marco Rubio of Florida, your trade advisor Peter Navarro have been recommending an executive order that would ensure that the raw materials for pharmaceuticals and medical devices are manufactured here in the United States. We were getting some indications last week that you were close to signing this executive order. Can you tell us?
Well, we're
where
looking
you
at
are on
different
that?
things, John, and I don't want to say exactly. Right now, China's been sending us everything we need, but we're looking at some alternatives, yes. We are looking for alternatives. And we have other places. Ireland does a lot of work for us. You know that in that world, in the pharma world. A very tremendous producer. And we are looking to bring a lot more back home. And excuse me, you know me for a long time. I've been talking about this for many years. Long before I decided to run for president, I've been talking about this. And we have to be able to take care of our country. And that was one of the many things on the list. So we'll be talking about it. But we are discussing it. And Marco is very much involved. And Peter is very much involved. A lot of people are involved. And a lot of people feel that way. We'll be discussing. Let's go, please.
Thank you, sir. You said Canada has closed its border to non-citizens. Are you considering...
Not to the United States.
Not to the United States, of course. Are you considering closing the land borders in the United States? And also, you've discussed...
Well, Canada has not closed it to the United States. Right. So we're working very closely with Canada. But they have not closed it. They have closed it to the world, but they have not closed it to the United States.
Considering closing the U.S. land border.
I don't want to say that, but we are discussing things with Canada, and we're discussing things with Mexico, quite honestly. And again, the relationship is outstanding with both. Outstanding. We just signed our deal, USMCA, and the relationship is very strong. Go ahead, please.
China and others have criticized you for using the phrase Chinese virus. How do you feel about that? Are you going to continue using that phrase?
Well, China was putting out information which was false, that our military gave this to them. That was false. And rather than having an argument, I said, I have to call it where it came from. It did come from China. So I think it's a very accurate term. But no, I didn't appreciate the fact that China was saying that our military gave it to them. Our military did not give it to anybody.
Critics say using that phrase creates a stigma.
No, I don't think so. No, I think saying that our military gave it to them creates a stigma. Please.
When you speak to travel and tourism executives today, what specific help are you going to offer to them, or is it still vague?
Well, we're going to help. They need help. Look, let's face it. You know, they go from having record-breaking years. This is the third year of record-breaking years, travel and tourism, airlines, everything. They were doing record numbers, ordering new planes, building new hotels. Everything was really hunky-dory. And then one day, we hear about this rumor in China, and then we find out it's much more than a rumor. And then all of a sudden, we make a great decision to close it up early. It would be a whole different world. It'd be a whole different world, but we make a decision to close it up to China, and all of a sudden tourism, and then we close it up to Europe, which, people never heard of this before. I'm not sure that that's ever been done. I know that when I made the decision to close it to China, people told me that's never been done before, but it was a great decision. We make good decisions. So I'll tell you my best decision. The people behind me are total pros. All over the world, there is Dr. Burns, Anthony, who's become a major television star for all the right reasons. No, he's just so professional, so good. The people that we have working here have been incredible. And they're totally respected. The Admiral has been incredible having to do with the testing. Incredible. And he's viewing this as testing also for the future. We're building a platform. When we took over this platform, first thing the Admiral said was, this was not designed for what we're talking about, millions of people. It wasn't. And it's nobody's fault. It's not like, who could have ever predicted a thing like this? But we broke it down, and it's really going to be an incredible system. And it is now a great system. I just want to say, these are incredible people standing behind me. They're the most respected in the world. Every country that you've mentioned today so far has called them, and they call them all the time for advice. There's nobody better than what we have. Say it?
Why did we see Dr. Redfield the last couple of days?
I don't know. I can't
He's in
imagine.
Atlanta running the CDC.
I can tell you he's doing a good job. We're very happy with him. Yeah, please, you have it. Go ahead.
Mr. President, yesterday we were being told that the payroll tax was going to comprise the lion's share of the fiscal stimulus.
Right.
We also had the markets fall quite dramatically yesterday. And did that
It wasn't about the payroll tax.
Did that inform your decision? What made you make that change, and when did you make that change?
Well, I didn't make a change. We're looking at payroll tax, and we're looking at various other forms of getting money to people. And the payroll tax is something that I've always liked. The problem is it does take a period of time, months, before they really see something. And we don't really have months in terms of people living. A lot of these, you have people that work on tips. You have people it's a large number of people. It's a tremendous, who would think this, right? And they do nicely. They work very hard, but they work on tips. We have to take care of our people. We don't want to have people suffering during this period. It wasn't their fault that this thing all of a sudden was upon us. So we're looking at we're also looking at payroll tax. It's possible. It's also possible we'll do a percentage of payroll tax and then other things. But we'd like to be able to get money to people. We're very lucky. Our country's doing so well. We can do this, and we can do it easily, but we have to do it. And I have to say, Mitch McConnell, if you look at Mitch and Kevin and the whole group, and it's been incredible how they're reacting, how Congress is reacting, how, whether it's the House or Senate, how they're moving. And I'm talking about Democrats and Republicans, but we've had tremendous leadership meetings, and they want to see it done right. And they do want to go big. I think going big is important. I don't think we want to go up there every day with a different idea, a different concept. Oh, gee, let's worry about the airlines. Let's do this one. You have a big problem with the cruise ship industry. It's an industry that was setting all sorts of records 2 months ago. Then all of a sudden, there's nobody on the ships, okay? So we have to help these. These are great industries. These are going to be taking care of people and passengers and for years to come, and paying tremendous taxes for years to come. So we have to make sure that this is done. Yes, John?
Mr. President, I want to bring up what you referred to just a short while ago about politics. In your address to the nation, you said we have to put politics aside, stop the partisanship, and unify together. This morning, you criticized the Democratic governor of Michigan. Yesterday, it was the Democratic governor of New York. You've attacked Obama. You've attacked Biden. In fact, every day except one since that address, you've lashed out at a Democratic leader. Are you going to set the example?
I only do that when I have to respond. I watched her on television. She said something that was false, and therefore I did do that. And I will continue to do that. If they're not going to play fair, because, they have the media on their side, I don't. I just have me. And if they're not going to play fair, I'm going to do that. If they are going to play fair, there's going to be nobody better than Donald Trump in terms of bipartisanship. But if they're going to say things that are false, like the story that was written yesterday, a lot of people, I don't know, somebody I think I know who, but they taped the conference call that I had with the governors. It was a good call. It was fine. I assume somebody's going to tape it. They handed it to various people, and one of them was the New York Times, and the New York Times chose to write totally inaccurately about it. It was a disgraceful thing. It was bad journalism, but, you know, they do a lot of bad journalism. But we respond to that, and actually, people get it. People get it. No, I want it to be bipartisan, and nobody's going to be better than me, but when they attack me or the people, these incredible people behind me, I'm not going to let them get away with it. I can't do that. Okay, how about one or two more questions? Go ahead, please.
Follow-up on the 15-day
Please.
guidelines was the next natural step. Is the next natural step after that a national lockdown similar to what San Francisco is doing?
Well, you can do a national lockdown. Hopefully, we're not going to need that. We think of everything. I mean, we have every idea that you mentioned we've thought of, and, you know, it's a very big step. That's a step that, I mean, in one sense would work. It's a very big step. It's something we talk about, but we haven't decided to do that. Please, go ahead.
Mr. President, what would be the determining factors for you to take that action?
It would have to get to a level, I just don't think it's going to be an action that we're going to take. I don't think I'll talk, but Anthony, all of the people standing behind me would get together in a room, plus some additionals, and we would make a decision. But I don't think that's a step that we're going to be taking. All right, one more question. You didn't have one, did you? Come on.
Will the U.S. government provide financial assistance to Boeing and airplane suppliers like GE?
We're looking at that. We're certainly looking at Boeing. Boeing got hit hard in many different ways. Boeing never had a problem for years. They were an incredible, it was unthinkable what happened with respect to Boeing. Unthinkable. Probably, I would consider it the greatest company in the world prior to a year ago. Now they get hit in 15 different ways, and they have different management. I've met the new people running Boeing. I think it's going to be outstanding. But yeah, we have to protect Boeing. We have to absolutely help Boeing. They were doing a job. They were getting, it was coming along well, and then all of a sudden this hits. So obviously, when the airlines aren't doing well, Boeing's not going to be doing well. So we'll be helping Boeing. Yeah.
Can you just respond to something, Mr. President, before you leave, just on what John was saying? You've called for people to leave politics out of this. Joe Biden said the World Health Organization offered testing kits that they had available to the United States, and to give it to us now, we refused it. We didn't want to buy them. PolitiFact says the WHO never made that offer. Can you tell us?
Well, that's what I heard, and I'm going to let Tony answer that question, or whoever's best at answering that. But I do have to say, when you talk about politics, I watched the debate. Not too exciting, but what they said about me, and we've done a great job. When you talk about not being bipartisan, what they said about me, and if you look at swine flu, the whole thing, and I guess it was 2009, and what they did and the mistakes they've made, they were terrible. They were horrific mistakes. 17,000 people died, and I'll be honest, they shouldn't be criticizing because we've done a fantastic job. The only thing we haven't done well is to get good press. We've done a fantastic job, but it hasn't been appreciated. Even the closing down of the borders, which had never been done, and not only did we close them, but we closed them early. The press doesn't like writing about it. So we've done a poor job on press relationships, and I guess I don't know who to blame for that. I don't know. Maybe I can blame ourselves for that. I will blame ourselves, but I think we've done a great job. I think we've done a poor job in terms of press relationship. But let me have somebody answer your question.
Yeah, so I tried to cover this in the answer when I talked about quality of kits, and our quality analysis runs through the FDA. So all of these platforms, we have asked people to submit, and we've asked states to quality control. So, I mean, anybody could submit their test to us. We don't buy tests that haven't been quality controlled, and they show us the data. Either show us the data up front or show us the data after they've been running them. Because quality testing for our American people is paramount to us. It doesn't help to put out a test where 50% or 47% are false positives. Imagine what that would mean to the American people. Imagine their level of concern now and telling people that they're false positive. We take this same approach to HIV. Imagine telling someone they were positive to HIV and they weren't. So that is our bottom line, the customer, the American people first. And so any of these groups can submit their testing kits through our regulatory processes. But without that and without a plan, we are not going to accept tests that have not been studied by us.
Good answer. It's a good answer. Would you have something on that?
I'm just going to emphasize a little bit more on that. When I became involved in the testing world, I called as senior officials at the WHO as I could find to understand what the situation was. And as far as I can tell from sources that should know, no one ever offered a test that we refused.
That's what I heard too.
This is a research grade test, right? Research grade test that was never was not approved, not submitted to the FDA, that was supplied in tens of thousands of quantities to 100 countries in the world, okay? So I think there's a lot that people are saying about this that's just based on rumor and myth. Nothing was offered that we refused. It was a research test that was not approved. And again, there was a small number that we have greatly surpassed in a very short period of time.
So number one, nothing was offered. Number two, it was a bad test. Otherwise, it was wonderful. Listen, thank you very much. No, he made a mistake. I assume that he'll apologize. He made a mistake. Thank you all very much. Thank you. We'll be back. Thank you all.
You got my attention. See you soon. What's on your mind? Off with you. You got my attention. Watch your back.
Doom Eternal is an intense game, and at times you can be forgiven for feeling a little overwhelmed by the demon horde, especially at higher difficulties. So to make sure you're ripping and tearing in the most efficient way possible, we've got a few tips to get your slaying started. The chainsaw works a little differently in Eternal than it did in Doom 2016. In fact, it will become essential in obtaining the valuable ammunition you need to mulch enemies. You should be revving that thing much more than you did in the previous title, as now it will automatically charge to 1 pip, which is all that is needed to shred apart basic imps and soldiers, but you'll still need to find fuel out in the world if you want to bisect larger enemies like cacodemons and revenants. It took me a little while to break the 2016 habit of saving the chainsaw for larger foes, but in Eternal you should be cleaving demons at every damn opportunity. Another way to get ammo if you're short between arenas or want a few extra shells and rockets before you leave an area is to take advantage of the exploding barrels around you. Not only are they great to help you jib enemies that wander too close to them, but with the right upgrades they can also be a method of resupply. Using a combination of the thicker skin, environment, and generating barrels upgrades means that not only do the big red barrels drop munitions, but they also respawn, and with immunity to their blasts you can go around shooting and punching them to your heart's content until your pockets are brimming with bullets. It took me a while to realize, but both your frag and ice grenades exist on their own cooldowns, so you can spam both, detonating carnage and freezing blasts to your heart's content. This can be super useful in moments where you freeze a bunch of demons to give you some space, only to blow them apart with frags, or to be sure you have spares to stun any cacodemons with a shot to their mouth. After a few upgrades too, you'll be able to fire them out rapidly and get all the bonuses that come with turning imps into ice cubes or zombies into a thin red paste. Through your playthrough you'll start to find sentinel crystals that can be used to increase your health, armor, and ammunition levels, but if you link them in the same skill tree you can get powerful upgrades. Some of our favourite combinations are Loot Magnet to bring all those sweet drops to you, and combining Quick Draw Belch and Belch Armor Boost to make the most of every fiery shot you unleash from your shoulders. It also means you'll get every armor shard possible, and since you're battling through a demon-infested Earth, you're going to need them. Runes also offer valuable passive upgrades as you come across them during your crusade. Now, what room you use may rely a lot on your playstyle, but there's a few standout ones I can heartily recommend. Seek and Destroy will allow you to launch into a glory kill from further away. This is not only great to regain health, but it can grant some valuable invincibility during the animation and get you out of a sticky spot if you're cornered. Punch and Reeve means that you can fire away with Blood Punch much more safely, as you're guaranteed to get a good chunk of health back with each meaty right hook. Dazed and Confused increases the enemy's stagger state, which may not seem that valuable, but later in the game where arenas can really get hectic, you'll be glad that demon you didn't get to tear in half is still kindly waiting for you to finish it off. Personally, I'm also a fan of Chrono Strike. Using your weapon mods in midair will allow you to slow down time, which is great to assess the situation you're shortly going to be landing into, or just for maximum cool points when you land an in-air slow motion headshot on whatever soldier is below you. You'll visit it once through the story, but remember you can always go back to the Doom Fortress prison if you want to warm up, try out a new weapon build, or just practice things like movement and weapon switching without consequence. All those imps are locked up down there in the bowels of your fortress, so you may as well use them for something. Doom Eternal comes with a whole host of new movement options available to you from the outset, so be sure to utilize them. It's weird that it feels like I'm barely on the ground while playing this game, but movement is key to staying alive in Eternal. With all the enemies firing rockets, whipping energy blasts, or mobbing you with their numbers, you can get overwhelmed rather easily. As badass as the Doomslayer is, he's far from invincible, so agility is the best defense from fireballs and rocket blasts. So keep an eye out for things like monkey bars and keep dashing as soon as you're able to. And don't be afraid to use the Super Shotgun's meat hook to drag you out of the fray and towards that lone enemy. Not all perks are created equal, and some will serve you much better in the early game, especially when Praetor tokens are harder to come by. Thicker skin and frag stock-ups will allow you to shrug off barrel explosions and fling your own munitions much more frequently, and getting Item Finder as early as possible will make it much easier to find future upgrades and collectibles too. That is as long as you keep one Slayer eye on your map. It'll help you find more tokens as well as Sentinel batteries, which will then allow you to unlock more tokens and items back in your fortress. So there are a few tips to get you started in Doom Eternal. If you have any of your own, be sure to leave them in the comment section below.
So GameStop is a terrible company. I mean, that much is obvious to everyone, given the fact that it is a company and also GameStop. But there's nothing like a crisis to bring out the worst in a bunch of pricks. And the bunch of pricks at the top of the GameStop corporate chain are being an incredible bunch of dicks if the workers on the ground floor are anything to go by. With the coronavirus epidemic officially screwing up everything for everyone, if not for the sickness, at least for the systemic failures we're seeing around us. Many public events are being cancelled, my wrestling calendar is now empty for months. People are being advised to stay home as much as possible, to engage in that whole social distancing thing where we're not all close together, spreading our muck amongst each other. And non-essential businesses around the country, hell, around the world, are closing down for the duration of this outbreak, at least while it's at peak crisis. Now, let me ask you a question. Is GameStop, in your opinion, an essential business, an important business that must stay open in the face of an outbreak? I don't think so. Personally, I don't. I, however, am not the CEO of GameStop. No, I'm not George Sherman, whose company continues to keep its retail outlets open, exposing those aforementioned workers on the ground floor to a huge fucking health risk. But worse than that is the fact that GameStop promised that measures will be taken to keep those workers safe, that measures will be taken to keep each GameStop location sanitized and as healthy as possible. And apparently, GameStop is talking bollocks. Hand sanitizer is one of the biggest issues. GameStop said that it would be providing hand sanitizer to all its locations. GameStop has not done that, according to many reports from GameStop workers. GameStop can't keep up with the need for that much hand sanitizer, and it's been telling employees that they can go and get it themselves and expense the company. The problem with that is that a lot of workers can't find that kind of thing, or toilet paper. I can personally attest to that latter point, because we're in the middle of a global outbreak of a virus and people have stocked up. Some of them unduly, some of them a bit too fucking much. But regardless, the fact on the table is that hand sanitizer is not available to tons of GameStop workers in a, what we call, high-touch environment. Basically, hands are being run all over the fucking place, and if hands are being run all over the fucking place between the retail workers and the customers, you need to sanitize that shit if you insist on remaining open. GameStop insists on remaining open, and it can't sanitize that shit, exposing not just its own workers, which is bad fucking enough, but its own customers. And you just know that they're insisting on staying open until at least Animal Crossing and Doom comes out, but is it worth it? Well, I guess if you're George Sherman it is. The GameStop subreddit is full of GameStop employees who are voicing their grievances, their worries, their concerns, their outrage at what they believe is dishonest and reckless behaviour on the part of the company that employs them. One popular post on the subreddit lays out the issues in a calm, measured, but comprehensive and justifiably angry manner. Major retailers across the board are adjusting hours, if not just closing. It writes, schools are shutting down across the country. This leads to even more kids going literally everywhere, especially here. We've had the best sales days we've seen in months, so of course corporate wants us to stay open. Most stores are out of almost everything relevant. This means now people are combing through all of our inventory to find anything that was missed. This means people that could be carrying but not exhibiting symptoms could be contaminating our entire stores. Corporate responded by saying they've supplied us with sanitization supplies and hand sanitizer for high-touch surfaces, but most stores have seen nothing. Our entire stores are high touch. It's how we brand ourselves as being superior over so many of our competitors. They sent a message out via email and show a message on GSTV several times a day to reassure guests that we're doing our best to prevent spread. They're lying to everyone at this point. All corporate cares about is making up for those missed sales earlier in the year and buffing for what we're going to miss later. I can't clean anything in my store. I can't ensure my team isn't carrying it right now. I can't guarantee I won't accidentally contribute to some of my favourite regulars who are highly susceptible and end up making them sick. Corporate doesn't give a fuck about the customer or the stores. They're taking advantage of this awful situation. Every day we're open regular hours, the more places are closing. Some states/cities are down to delivery and takeout for food, but we're still here slinging games and KPIs to keep our jobs. As more places close and adjust hours, and we don't, we become one of the last destinations for people to go. This means we become a hotspot for spread, especially considering we're still taking trades from anyone that walks in, which contaminate even more of our other products. They go on to say that GameStop needs to tell people not to do launch events for Animal Crossing or Doom, which, yeah, that should happen, because to not do that, to allow launch events to go on, to encourage people to gather in a small little GameStop store would be reckless, idiotic, dangerous, callous, and disgusting. I was personally contacted by at least one store leader who wanted to remain anonymous because, well, of course they would. People have to remain anonymous when they criticise a corporation because their jobs are on the line, which of course is why GameStop workers are feeling pushed to still go out and work because their jobs are on the line. No one wants to be fired. And the fact that anyone could feel that their job is at risk if they dare to take sensible medical advice to heart is utterly atrocious. If anything, GameStop should have been one of the first companies to lock its shit down and not fire anyone as a result. Look, I know that things in recent years have been desperate for that pathetic, grasping, clawing company, but keeping stores open to profiteer during the coronavirus outbreak is a new low. Especially if these stores are still accepting trade-ins. What the fuck? No! Don't accept trade-ins. Don't let any stranger walk into your store with a handful of shit and just give it to you while you don't even have any hand sanitizer. GameStop. No! Tell your workers not to accept trade-ins for the next couple months. It is bad enough you're staying open to capitalise on the boredom of a quarantined populace. It's bad enough that you're staying open so that you can sell Doom Eternal and Animal Crossing. But that's corporate thinking for you. Don't change anything for as long as you possibly can, even if you're putting your own employees at risk. GameStop is far from the only corporation that's been continually and woefully unprepared for this situation. It's just the one relevant to this channel. If you're a non-essential business, shut down. Compensate your workers. You know, even if the executives at the top have to have a little bit less of their millions of dollars, shut your shit down and compensate your workers. And if you can't do that, if you can't protect your employees, what the fuck are you doing having a business, being a business, staying in business? How fucking dare you have the sheer shitting gall to continue to exist? So anyway, GameStop, run by wankers. You knew that already, but this is a grim, grim reminder.
Go do that. Oh, dude. Good to see that Amazon's still pumping though, right? Y'all watch your cell phones. First of all, big true, dude. I'm actually surprised that I'm surprised stuff isn't spreading. Cell phones are just, there's almost no way around it too, right? Doesn't that kind of surprise you how dirty cell phones are and how you kind of have no choice but to touch it? So you can keep trying to wipe it down, but yeah, you can see the holes, the cracks, right? Ammo getting low. Thankfully, no concerns there. I have a ton of 5.56, 22 long LR, 9 mil, 12 gauge, slugs. I'm good on that front. It's super good. I've been doing little mini kind of mini little kind of tests too, like functions checks on gear, equipment, strategy, and stuff like that. That's why I feel ready, dude. Put on latex gloves before opening the package. Remove gloves and wash hands after. It's pretty good, yeah. Yeah, man, I'm ready. Everything is ready. That is the strat. This is the strat that I feel the most kind of hype around. I don't know. No one really reacted to it yesterday, but I'll tell you, the #1 way to practice home defense, or the #1 strat for home defense, I really do believe in my heart of hearts, and every single person can benefit from this, is to set up a fighting vest for yourself. I know you think I'm crazy, man, but it is the most revolutionary thing. It was the type of thing I just knew it was the best play ever as soon as I set it up. And what do I mean by that is you set yourself up kind of a chest rig fighting vest that you have right near your bedside, right? And I'm telling you, man, in a 5-second window, because you pretty much need to be ready to go in a matter of seconds, not minutes, right? There is no time to scramble and get everything you need. So in a matter of seconds, if you were trying to, you know, in a sleepy, groggy, dark state, all you got to do is put on a vest, which anybody can do reflexively, and then you are in like peak fighting condition. I'm telling you, man, it's the play. It's the play. I hope someone tries it. Not a thing in Europe. Well, it could be a thing anywhere. You just set up a vest. You don't necessarily even need to have firearms, man. I'm telling you, you don't need to have firearms, but I'm just saying, you had everything you would need in a vest. This is what I mean. I'm asleep, I'm unconscious, I wake up, middle of the night, you just look right, look left, grab your vest, and you throw it on. And if you think about it, at that point, yeah, fighting vest. I don't think people are understanding what I mean by that. You have everything you need and then some. So, you know, you would have like a pair, at least for me, I have a pair of handcuffs. I have like a flashlight in one of the pockets as well. You have tons of extra mags around the bottom part. And then, you know, you have a secondary weapon. You don't necessarily have to, like, if you're in a place that doesn't have firearms, then you could, you know, just put like, you know, an extra knife or some kind of like bear mace or something like that. But you throw this vest on, because if you didn't have that vest, you're going to be like butt naked in your house, you know, holding like a pistol or something like that, and you have nothing else. You have no extra mags. You have nothing. You're just standing there in your boxer shorts. You know, you're not really in a great position at that point. But when you have a vest on, man, oh man, you become so much. Your power level spikes way up. What's in the vest?
Cargos has one of those Call of Duty tutorial training courses in his backyard. Looters better beware. The Chad doesn't mess around.
Yo, Chris, thanks for the 10, dude. No, I don't have a training. I do have a nice little plinking setup though for the air rifles. We can't discharge firearms here in my county. So, why do you need weapons to fight a virus? You don't need it to fight a virus, but you need it to, you know, if there's scarcity of finite goods and resources, and if someone tries to break in or something like that, like I live in a very population-dense area, right? And if, you know, someone tries to break in and grab stuff or whatever, you know. I'm picturing a McLovin vest. Oh yeah, zip ties. Yeah, absolutely. No, I mean, one second. This is #1 proprietary strat. It will give you so much more peace of mind. Give you so much more peace of mind. For home defense, it could be whatever you have access to, but you set up a vest. This is what mine looks like right here. It's a vest that you just throw on. You can do it while you're groggy in the middle of the night. It has compartments on it. It has MOLLE webbing on it. You can keep like a speed loader in one. You can keep, what else is in there? Little flashlight, little high lumen flashlight. Best thing ever, man. It's just the strap that I'm like most proud of, man. No, I have sappy plates. Yeah, well, you're talking about the IOTB, right? I have that by my rucksack. It's not a bulletproof. It's not a bulletproof vest. It's just like a little flick. I live in Germany. I never thought about such a thing. I'm telling you, man, it's the best play. Because if someone is gonna break in your house, you're gonna only have seconds to react, right? And you're not gonna be in a great state of mind. You're not going to be ready. And if you're fumbling around, and you can even try this at your house, try to actually lay down and envision somebody kicking in your door. Oh, I have a flashlight in there too, yeah. There's one right in the pocket, multiple flashlight sources. There's also just one on the actual, you know, but imagine someone kicking in your door and you're in your boxer shorts because nobody's sleeping fully clothed up in tactical gear. Like, it's not going to happen. You're going to be in your boxer shorts. You're going to be butt naked. You're going to have sweatpants on, like, you know, like a tank top or something like that. Someone kicks in your door and you have 10 seconds to get on target. 90% of the people watching right now would be fumbling through their drawer trying to find shit. Like, it would be too late, man, to be honest. So, you know, practice it. Have some kind of system that you can do when you're in just a really, like, semi-conscious kind of state. The guy that breaks in doesn't have a gun too. Oh, they're gonna have a gun in America. If you're breaking into a house in America, dude, there's a lot of guns in America. Like, if you're gonna, you know, be that type of person to go try to loot and break in, you're definitely gonna be strapped. My husband will all of a sudden come into the room and say, "Okay, think about someone trying to get in the store. Now, what do? Don't think, react." I get that deer in headlights up. That's what I'm saying. That's where you got to practice it. And I'm telling you, the whole fighting vest thing, I think, is genius. You can look at all these different, you know, home defense channels, preparation, readiness channels. For some reason, I never saw anybody advised to do that. But all you got to do is throw on a vest, and then you're more than prepared to deal with the situation.
Watch your back.
My old captain used to tuck a pistol into his sweatpants when he was home in Baltimore. That's some safety implications there. Yeah, exactly. You got to practice too, right, Sun Rap too, because honestly, people always say, you know, people want to have all these, you know, flashy type of firearms or whatever it is to defend your house, but you need to be proficient with it. If you're more proficient with like a bow and arrow, use a bow and arrow, dude. You actually have to be proficient in what you use it. Bow and arrow is actually kind of slap too, though. Where'd you get your vest? I think I just got mine on Amazon. But yeah, go look at like a FLIC, Fighting Load Carrier, is what it stands for. That's the abbreviation. So it's just like a little, you know, it's not like an armored vest or anything like that. But this is the abbreviation. It's a Fighting Load Carrier. Order a vest, have it shipped to your house, and then just load it out with everything you would need to address a situation if someone were to break in, right? Some zip ties, you know, handcuffs, flashlight, you know, whatever you have access to, some kind of like secondary weapon system, anything like that. Where do you live that you have 22 days of lockdown? I live in the San Francisco Bay Area. I live in East Bay. Crossbows, think about crossbow. Is the crossbow, you only have one shot. Because the thing with the crossbow, if you ever used it, you have to step on it and then pull it back. And it's got like, it's kind of heavy. It's like 50 pounds. In some kind of break-in or like home defense kind of situation, you have one shot with the crossbow. You could have one prepped right there. And then you get up, you get the crossbow, and you fire like one bolt. But after that, it's pretty much GG. You're not going to reload that. Those crossbows slap, though. You could, like, even the little handheld ones, very, very powerful. You can get repeating crossbows? Oh, really? I didn't even know that. Gotta use the flick to hold all the tactical MRE spoons? Oh, yeah. True. I knew a guy who insisted he would be able to defeat an intruder with a gun with his katana sword he kept next to his bed. He insisted he could be up and slicing faster than someone could shoot. Hey man, I mean, to each their own. How many titanium sporks does your flick carry? You could carry quite a few. Yeah, I don't know. I think one thing people sleep on is having some kind of handcuff or zip tie. Because imagine if somebody did break into your house. What do you actually do with them until the police get there? It's probably going to be like 15 minutes before the police gets there. That's one thing about where I'm at right now. That it's not that I think the police are incompetent out here. It's that it's going to take them probably 15 minutes to get out here. And where I used to live in the past, it was more kind of hood than where I'm at right now. Like I used to live in Yonkers, New York. Yonkers, there's like lots of murders and violence in Yonkers. Like that's where the Locks, Jadakiss, all of them are from. They have like some projects in Yonkers as well. Yonkers is rough. There's all that stuff is happening on a daily basis. But the YO police department would be out there lickety split. You call them and they come out in force, like high speed, SWAT gear, everything, helicopters, whatever they need. Here, call the local PD, 15 minutes, man. It's gonna take them 15 minutes to get out of here. Yeah, I mean, if they end up, you know, activating the National Guard out here and having them, I will probably have to do something, guys, to be honest, because pretty much what it's looking like is that the healthcare system will get overwhelmed at some point. You know, it's about flattening that curve, right? So if that is the case, you know, they're definitely going to have, you know, National Guard set up little makeshift hospitals. I would imagine, right? Just to help have extra critical care type of beds. So, but that type of stuff I don't mind doing. I think it'd be pretty sweet. That's the main reason people sign up in the Guard. People don't necessarily sign up in the National Guard to go fight overseas and, you know, far off lands, but helping your home country and helping people in a very real sense like that seems pretty awesome. How much time and money went into creating the space you stream in? Not that much money, man. I made a lot of the stuff myself. Time took a couple months. You have to chip away at it. It's an iterative process, but I'm pretty happy with it now, Picard. Thanks for the nice words, man. Alright, we'll turn to the zebra hoof thing. Do you have COVID-19? I don't know, man. I haven't been tested. Hopefully not. It's possible. Could be asymptomatic. Sawed-off shotgun. Sawed-off shotgun would be good. Thing is, they're actually illegal where I'm at, Nicholas, and pretty much most places in the States, sawed-off shotgun's illegal. There is a barrel requirement, but there's a minimum requirement. So I think the shortest barrel you can have is 18 inches, right? So definitely though, short-barreled 18-inch barrel shotgun is fantastic for home defense. Absolutely. You can put a nice little shell saddle on the side, and you can put like slugs in the shell saddle, and then you load it up with 00 buckshot. So pretty much you have access to two different options, right? So you have it cruiser ready with buckshot in it, which is what you're going to use in 90% situations. But if you need the extra reach, if you need the extra distance, you can pull a couple shells off the saddle and load up some slugs. And slugs are like one huge metal piece. So people think of shotgun, right? Whenever you think of a shotgun, you think of a big spread, like birdshot, like how it sprays out into a big cone and hits stuff. A slug is just a solid chunk of metal. So you can actually shoot pretty far with a shotgun. Lazanta, holy smokes, with the monster raid, dude. Oh my god, Lazanta, dude, thank you so much. What is going on, man? That is insane. Lazanta, 206-person raid into the channel. Thank you very, very much, my man. I really appreciate that. Guys, we gotta shout out Lazanta. I have not had the pleasure of meeting this fine human being yet, but I look forward to the pleasure. Welcome everybody over from Lazanta's channel. We are currently in day 1 of 22 of lockdown with the coronavirus going crazy like this. My name is Cargos. I live in the SF Bay area, and we are on shelter-in-place orders right now for the next 3 weeks as of right now. So we're just kind of making do with that, talking about Corona. Everybody's talking about Corona, talking about WoW. Absolutely. Welcome, everybody. Welcome, welcome, welcome. Lazanta, thank you very, very much, my man. I really appreciate it. Even with the buckshot spread, it's not as big as people think. Yeah, absolutely. I watched some of your YouTube videos. Oh, we really got some new people in here, for real, for real. Yo, thank you for the nice comment, Exy. Look at all the follows, man. This is huge, Lazanta, man. A lot of these people, new faces. Welcome, guys. So we're also doing the hardcore challenge. I haven't been playing super serious mode right now, but we have one life, guys. Everyone from Lazanta's channel. If we die, we have to delete this character. You might have seen some other people doing the hardcore challenge. So that's what we're getting into. Seeing how far we can get on this guy. Another one, Flame Strike with the one viewer host. Thank you very much, Flame Strike. Appreciate it. Much appreciated. Welcome, everybody. Welcome, welcome.
Goodbye.
Alright, let's turn in Zebra Hooves. There he is. Lazanta, happy to be here. Dude, I really appreciate that, dude. That is a huge host.
Strength.
Hey, Lazanta, man, if you ever want to come on Good Morning Azeroth or anything like that, if you ever want to do a podcast, we're overdue. We got to do one this week, guys. I think Thursday we're going to do one. Def Camp and doing it then. They said they've had some people asking if we quit. We did not quit, GMA. Don't worry. We've just been slacking a little bit.
Let's get this party started.
All right. Cold card leaders. Oh, Prowler Claws. That's what we need. Okay, so we're going to do Semiflange and Prowler Claws. Let's do that right now. What is OP in World PvP? Lock or Hunter? Both are phenomenal, phenomenal World PvP classes. A lot of people will tell you that, like, people like OG Haptics, Big Brain, you know, rank 14 players will tell you that Hunter is the strongest open world PvP class. I would probably disagree with that. I've played Hunter extensively. I've played it 3 times as a main in a vanilla environment. I think they're incredibly strong in the open world, don't get me wrong. But I think the absolute Mike Tyson pound for pound heavyweight champion has the belt, always will have the belt, has the crown, is a Soul Link Warlock in World PvP. That is just the creme de la creme, the strongest pound for pound heavyweight champ of open world PvP. And you know, as a hunter, I developed a little bit of envy to Warlocks, you know, because I would fight them 1v1 and I would just go, oh my god, these guys have so much gas in the tank. They have Hellstone. If I do somehow by some miracle Viper Sting him to death over like a 2-minute fight, he's going to pop back up with 50% health and finish me off. Warlocks are the stuff of nightmares out in World PvP. The thing is about Warlocks is most people don't really play them in that Soy Link capacity. People actually meme on you for playing Soy Link. They call it Soy Link. That's one of the things about TBC I'm excited for. Soy Link is no longer kind of a meme. It's expected it's expected that you play SLSL. So that kind of is going to reinvigorate me to play Warlock. Thoughts on Druid in World PvP? Actually, Druids are very, very strong in World PvP. They're one of the strongest classes in World PvP. They're very, very hard to lock down as one class. Almost impossible. Like a geared Resto Druid or something. Can any one class kill that? I don't think so. In a duel, maybe if you're restricted to that circumference of a circle. But if there is a Resto Druid with full health and mana, with decent gear, trying to get away, I don't think any class could kill them. I don't think so. You need help. You need some kind of like root or peel, or you need something, man, to help out. You need like some setup with them. If you 3-shot Resto Druids, they probably just had pretty shitty gear, man. I'm telling you, if they stack stamina and they're spec'd properly, I don't think any class can like burst them down in time. And the thing is, even mages, which are just fantastic at like sniping people out, the Druids kind of counter the mages. In the sense that they can just shift out of all of their roots and slows, so the mages really can't lock them down. They can outlast the mage. So mages are pretty popular in PvP, right? And druids are the stuff of nightmares for mages. They just counter their whole kit. Can't poly them, right? They outgas you. and they'll just chip away at you. Here's the thing that I've heard about druids, though. First of all,
Let's get this party.
they're tricky to play because you don't know exactly what to do when you play druid a lot of the time. What line of play do you take? You definitely don't go into bear form or cat form and just man fight something. That's pretty much never the play ever. You don't just go bear form and maul something to death. You don't just go cat form and claw something to death. It's a hit and run style of gameplay where you're constantly swapping in and out of forms, throwing up heals, then going back into animal form to tick back up your mana so that you can out attrition people. You have to work for all of your wins as a druid. It's not face roll unless you're fighting someone with a very different like level of gear or skill. You're not just gonna open up on someone in cat form and just kill them if they're like decent, right? So you have to work for all of your victories. But with that said, druids out in the open world are very, very strong. Wait, is there going to be a TBC? I think, yeah, there's going to be a TBC. Probably 99% chance. No, everything makes sense. So there's going to be a TBC. Even at the last BlizzCon, they kind of said that they're not opposed to it. They just want to do it properly. TBC is going to make Activision Blizzard a ton of money, and at the end of the day, that's probably what they care most about, right? So, TBC Druids, the holy crap? Absolutely, man. I'm playing, holy shit. It's a lot of tigers. You go for an early War Stomp. This is one definitely strat if you're playing Druid, and you're going to go for a War Stomp line. Go for it early, because it doesn't always work out. You get some resists. Level 12 Huntresses, man. Alright, we should be fine now. I 3-shot a druid that had 10k armor as a DS ruin. Well, I mean, it's not necessarily about the armor, though. It's about the, I'd say, I mean, you have a certain amount of health. You in quarantine? No. Quarantine is different from lockdown, right, guys? Quarantine means that you have the virus and that you are being, you know, isolated from society. That's what quarantine is, at least in my mind. What I'm in right now is lockdown, which is you can only leave for essential stuff. What will happen to Classic, though? I hope Classic servers just continue to be a thing and they have them running as well as the TBC servers. Now, I would be pretty heartbroken and distraught if they made Classic servers turn into TBC servers and there was no more Classic. That would be a huge, huge L to take, I would say. What was the stats page you had up yesterday on the virus? I'll link you for it if anyone's interested in tracking the spread of this pandemic. 88,000 people watching this live stream. Holy shit, here it is. Did they say anything about TBC yet? No, but everyone's predicting they're going to say some stuff at BlizzCon. Here's the thing. Normies losing their minds having to spend 2 weeks alone. Are they? What do you think, man? You think they actually are? Are people actually struggling? Are they struggling with the stay-at-home orders? I mean, I know we're all going to be good, right? We pretty much just do this nonstop anyway. At least some of us do. I don't know, like, my dad is a very social dude. He likes was talking to people, having weird dad jokes. He doesn't seem to be having too much trouble so far. If anything, he's kind of just happy he's working from home. I feel like that's what a lot of the... People are probably just so excited they don't have to go into work, right? Yo, peace out, Lasagna, man. Be safe, man. I know extroverts in these times will have it tough, true. Maybe. Can you be extroverted and introverted? What do you guys think? Because I actually do consider myself an... it's not even what I consider myself. Most people will consider me an extrovert. Like, I like going to happy hours, talking to people, and, you know, just like bullshit and shooting the shit, stuff like that. But I also like being just alone and playing WoW. I kind of like both. I think you can be an extrovert and an introvert. I think it'd be situational. Omniverted, damn, that's big brand. Oh shit, is this Avalanche? It is Camouflage. Let's go do Camouflage. CDC predicts 70% of the U.S. will have coronavirus by mid-May. That's what I keep hearing. These big brain experts in viral diseases and stuff. They are saying that it's almost inevitable that between 40 and 70% of the global population will get coronavirus. That's an unfathomable number of people. I mean, if that's true, how many people is that? Because how many billions of people are there on the planet right now? If half of the population were to get coronavirus, how many people is that? And then they say out of the people who get coronavirus, they say I think it's about 12%, I believe is the number. 12% will need some sort of intensive care or hospitalization. I believe that's what they said, 12%. And then out of those 12%, I think they said, you know, like maybe half of those people would need a ventilator or some shit. That's a lot of people. I mean, that is... I don't know. I don't buy it though, honestly. Like I know I'm talking about prepping and all this type of stuff. I don't buy that though. You really think half the global population is gonna get coronavirus? That just seems insane. I mean, you already have places like South Korea right now that apparently appear like that they are halting the progression of coronavirus. This is some of the best possible news, guys. Right? So I don't really trust China's reports on them having control of the virus. Oh shit, I'm kind of low. I misclicked. You know, they're saying that they have it under control. If you've been monitoring that page I just linked, they've been at like 80K for days upon days now. And it doesn't look like the virus is spreading anymore. I don't really necessarily believe what China's saying about that. But South Korea is, as a U.S. ally. We have military bases in South Korea, and I don't see a whole lot of reason for South Korea to want to like cover stuff up. And it seems like they're stopping the spread there in South Korea. So that to me is the biggest sort of case study here, or the biggest example of maybe a society doing a really good job of stopping it, right? So there's some inconsistency there when people say 40 to 70% of the global population is going to get coronavirus, but then you also see in the early innings South Korea already halting it. I think it's a possibility that in 2 months we could stop it like South Korea stops it. What do you guys think about that? You think that's possible? 2 months and we'll be fine? Or at least turn the corner? Here's the thing that is very scary though. I said it earlier on the stream. South Korea is one of the most technologically advanced nations. They are, gamers. They are just like, they have machine learning, automation, all this type of stuff. They're actually very progressive and technologically in a lot of ways, right? And they probably have a lot of doctors per capita. What people were saying about Africa in particular, of how they have 0.01 doctors per 1,000 people, and now we're seeing corona in Africa. That is the stuff of nightmares, right? Like how fast that could ravage African nations if it were to spiral out of control there. I think there's a lot of eyes monitoring the current state of affairs in Africa right now. It'll come back next year with yearly influenza. It might be the type of thing. It does, yeah. Yeah, it might be. I mean, people are hoping that there's going to be a vaccine or a series of vaccines. Maybe 2021 or something like this, but... South Korea started testing much earlier, and they are much more respectful of being told to stay in their homes compared to other countries. Yeah, I mean, whatever they're doing, it seems like it's working, and you definitely trust the data there. African nations will have similar infection rates of others, but they'll have more deaths. But wait, no, those two are correlated, right? Those are correlated. If you have... You need more infrastructure and organization to prevent people from going outside and spreading it more. So if there's less access to healthcare, there's less, like public services to keep people inside, like weaker supply chains on food, water, electricity, amenities, you're going to get more infection because... Oh, shit. You're going to get more infection, right? Like, weaker infrastructure across the board is going to lead to more infections, and then that infections can snowball. Did we really get a huge snowball infection here in the States, at least? I don't think we have. The closest thing was probably that that old folks home they've been talking about. You guys been hearing about this? Like for a little while, like half the deaths were from this one senior center or something like that. It's probably as close as it gets, but I don't know. I mean, we're gonna start testing on a much broader and larger scale right now here shortly as they start pumping out all those tests. So we'll have to see where everybody's at. Doesn't seem like we had some huge viral rampage yet. India, that's a good point. I don't know though. I feel like India very I feel like they would have amazing medical facilities. Am I wrong? The thing is, India is huge, right? And they do have a lot of slums and stuff. Like, what is that area with that river? And the river is like a spiritual river, and they go like drink the water or something. They might have the strongest immune systems ever though, because apparently there's all kinds of fecal matter in that river and all types of crazy stuff, and they drink it. They might be just straight up immune to coronavirus. They'll probably develop some next level antibodies. Dude, imagine you drink that water and you survive. You probably turn into a superhero. I think if I drank that water, I think if we drank that water, half of us would die. For real. I feel like half of us would die. So if you drink from, the Ganges. If you drink from the Ganges and you survive, I don't think coronavirus can touch you. I think you're next level, dude. You have like immunity to everything. No, it's not racist, Doc. Not at all. I got lots of Indian friends. I went to school with Indian. I love Indian food. I'm just saying what it is. What it is. That river is extremely dirty, right? If you drink from that and you survive, you're probably good to go.
What's on your...
But at the same time, I don't know. I feel like I don't know. I feel like they would have, like, because India, they're very on board with technology. Like, they have a lot of really like good technological advancements there and stuff. I feel like they would prio health and make it a national priority. And I don't know. I just, maybe it's a gut thing. I feel like they would defeat it. The good thing about African India is they have younger populations. That's true. That's true. India still has a problem with swine flu. I don't think it's going to be nothing with COVID-19. Which one is... So one of those, it might be bird flu or swine flu. I think it's the H1N1 or something like that. One of those is also a coronavirus. We aren't doing anything South Korea is doing? What do you mean? One of the things apparently I heard that South Korea is doing that's really good is they found their patient zero apparently, and they were able to go contact everybody that came in contact with that patient zero and was able to get that information out. And people are playing ball, and they've been going to great lengths to find out everybody that the people who have coronavirus have been in contact with. Oh, one thing I heard about too, guys, I don't know if it's true or not. Somebody was saying that in China, they made a new law that if you go into an airplane, you have to get a temperature check, right, to see if you have a flu. And if you go into the airplane and you took ibuprofen to lower your temperature to try and like pass the test, and you get caught for doing that, you go to jail. What do you guys think about that? You actually go to jail. That's legit. I mean, what if we did that in America though? Maybe not jail. What about you just got like a big ass fine or something? Jail is a little extreme, right? Because what if you did it by accident? That's the thing, man. There's gotta be people who do that by accident, man. Imagine you go to jail by accident. You're not feeling well. You have the flu, and you forget that you have a flight, and you take. Yeah. What if you you have a flight, you forget you have a flight, and you take some ibuprofen a few hours early, then you go to jail. Oh, the little rogue is still alive, Reddick. You don't forget. Oh, shit. Why am I always dying? Oh my god, I'm just misplaying all over the freaking place today. I doubt China cares about intent. I mean, I don't know. I think it's pretty good. I think it's a pretty good law. Cause did you guys hear about what happened with that Florida guy? Anybody hear about that? There was a guy who was going to Florida, and he didn't tell anybody on the plane that he tested positive for coronavirus. How pissed would you be if you were on that plane? There was a guy who knew he had coronavirus, but he wanted to go home. I mean, we can all empathize with that a little bit because you're just trying to get home. Thing is, he had his wife with him too, though. Like, what are you trying to get home for? What? You have your wife there, like, you know, just chill in Florida or chill wherever you're at. And he didn't tell anybody on the flight. And then when they touched down in the destination, he let someone go. No, he let the what is it? Somebody knows the story. He let the people on the airplane know. So he did let them know at some point. He didn't just go home. At that point, you might as well just go home. Like, I mean, he just incriminated himself big time. Big time. He told them, hey, look, I got tested positive for coronavirus. And then all those people had to get, quarantined and all that. That's a proper criminal? Yeah, dude, I would be pissed. That's why I'm so happy I'm not going to Philly, man. I was supposed to go. I should be in Philly right now as we speak. Your National Guard, how does this pandemic relate to you? So they've already activated the National Guard in a bunch of states. There's already a lot of stuff going on in California with the National Guard. I can't get into too many details with it, but the National Guard will definitely play a role in this, probably throughout all the states. And I would imagine that one of the major roles they would play is to help set up additional testing facilities, to help set up additional makeshift hospitals, almost like you're in a war zone, right? To hand out supplies, to sanitize areas, to hand out food, to do stuff like that. Basically just to assist, to have more boots on the ground to assist like the overwhelmed healthcare force. So if I get called to do that, which I probably will likely have to do at some point, I think what'll likely happen, I don't want to get in, too much into it, but I would actually be kind of excited to help out, because that's the reason people sign up for the National Guard, to help out on that type of stuff. Hurricanes, natural disasters, things like that. But they already activated them in a bunch of states, and there's COVID trainings going on. Hope if you get called to action, hopefully they provide the right type of protective mask and gear for you. For some reason, I don't think they would, man. I was looking at some of the New Rochelle guard who are out there. They're just walking around in OCPs, like they have no mask on or anything. I don't know if you've seen some of these clips. Patrol cap, OCPs, walking around. No protective gear, no iPro, nothing. And that's in New Rochelle, which is like the center of the corona epidemic out east. I feel like they should give them some masks at least, but... Absolutely hyped to help out in emergency. Yeah, that's what I'm saying, man. Help out the weak. It isn't airborne? It is airborne though, right? It's gotta be airborne. It's airborne, right? Someone's saying it's not airborne. Don't someone sneeze and then you get some of it, you know? Or maybe that's different. When they sneeze, is that not considered airborne? It is airborne, right? Yeah. About to say. The masks do nothing unless you already have it. I don't know, man. I don't know. It's gotta help. It's gotta help. There could be other stuff that protects you from too. Common cold, other stuff. Protects you from touching your face because you have something over your face. I think that's a myth, man, that the mask does nothing to help you. I really do. I know the virus can go through it, but just being in like a hospital environment or being around sick people, it's probably going to protect you from other stuff, having the mask on. Could be the cold, could be something else. It's also going to like signal everybody around you to, you know, posture check themselves and make sure that they're being sanitary, because there are people here that care about health and safety. It's like just like a health and safety kind of reminder every time you see someone wearing like a, you know, a mask. And it'll stop you from kind of touching your lips or face because you have it on. Thing is, all the masks are out. You can try and buy them on Amazon, anything, they're all gone. If the virus is inside of a water droplet or whatever, the mask will catch the droplet and the virus. Thank God we have WoW for times like this. Yeah. I'm kind of finding it a little bit harder to play WoW though with all this going on, because my mind is so distracted thinking about all this stuff. I love streaming though, I gotta say, man. I appreciate you guys so much. Being able to get these real-time perspectives from different countries, it's pretty insane. Since we started streaming though, guys, I have not seen a single person from Italy in the chat. I've asked this question, like, where is everyone from, a couple times. Nobody from Italy. Kind of spooky. I will ask again, is there anybody actually from Italy in here? Someone's gonna say they're from Italy, but I mean, I just rigged it. But that is kind of spooky, man. Oh, Sek is from Italy? Is he here? I don't think Sek has been in the chat though, that's what I'm saying, dude. It's kind of spooky. There was people from Italy in the past in the chat. Oh, he's been here? See, even if I'm saying this right now, there's really no one from Italy. Dude, I'm really not even joking at all right now, chat. This is actually dead serious. There is usually always people from Italy in the chat. At least a couple, I'll see it. There has been 0 people from Italy. They still have internet in Italy, right? It's not at that level. They're still just inside chilling, like, you know, playing games and trying to hang in there. I'm kind of disturbed by this. Italian internet also got corona? Dude. Maybe they're just maybe they're actually all just busy taking care of each other and stuff. Like they might be actually just trying to tend to loved ones and stuff like that. Let me see how many cases they have. Oh my god, yo guys, dude. I'm not trying to hype everyone up right now, but within the since I've been streaming, I shit you not, Italy has 3,500 more cases. I think maybe closer to 3,000. I know it was at 28 something before I started streaming. I've been monitoring this every couple hours, like every you know. Let me link this to you. Maybe they just made a big update. I don't think so though, man. They usually update this every couple seconds. It looks like they got... Oh, no, it just updated back down again. What? Oh, no, never mind. It's up again. I would take it with a grain of salt, but yeah. 31,506 cases. That just went way up, guys. Like 3,000. And the thing is, the US cases shot up by over 4,500. I mean, 1,500 in the last couple hours. Spain got a huge spike as well, 11,309. Dude, I really feel so bad for everybody out in Italy, man. I really, really do. I don't know what exactly happened with there, with the Lombardy. 10 minutes ago, I checked, it was 28K. That, you mean 2,800, right? Or no, 28K. Yeah, no, you're right. It went up by 3,500 since we've been streaming. Death shot up to 2,503. That is unbelievable, man. Dude. F's in the chat for our brothers and sisters in Italy, man. Golly. UK got it, yeah. Man, this maybe because there's more testing available. I don't know. But it's all going up. People were saying that everything was going to shoot up in the next couple of days because there's going to be more testing. The thing is, you got to see. China hasn't budged. China has been under 81K for like a week now. That's a little bit suspect for me, from my perspective. You really think that they haven't moved at all? Because they don't publish numbers? Well, they were publishing numbers or something, man. Like for a while. Youngest person killed was 39. Damn. I'm not buying the Chinese numbers yet. I mean, that's what I'm saying, guys. If you're looking for a light right now, or like hope right now, look at South Korea. South Korea, when I started watching this chart a few days ago, it was at number 4. It was behind Iran. And it was roughly where it's at right now. It was 8K or something. It might have gone up a little bit. Like it might have been low 8,000s, like 8,050 or something like that. It has only inched up a little bit to 8,300 cases. They're doing something right in South Korea. I kind of trust South Korea, man.
Well met.
China probably at 1 mil. Yeah, I don't know, dude. That's just so crazy, dude. I feel so bad for people in Italy, man. Well, you know what? I don't mean any disrespect by this at all. Like, I mean, Italian people are amazing, dude. Like, I have so many Italian friends. Grew up in an Italian, like, blue-collar Italian town. But I do think part of the reason, possibly, of why it spread so fast in Italy, can you think about this, is that they are kind of like they have low social distancing in their culture. What do I mean by that? Like they're very like they like to hug, you know, they embrace, you know, they give each other like a kiss on the cheek and stuff like that. That probably played a factor, I would imagine.
See you soon.
Yeah, family dinners, you know, probably just like sharing from the same same bowls and stuff like that. That's gotta be a factor. Can I send you an article on depression? Yeah, absolutely. Go for it. Yeah, that's gotta be, man. For those of you watching right now, we have it pretty good still right now, man. Dude, make it, you know. We gotta learn from Italy here. We gotta learn from Italy and try to set yourself up for success with this, guys. Please do. Get water, get everything you need right now. Where's Russia? Oh yeah, that was another thing. Russia says they only have. If you look at that stream I linked you guys, on the right side, like on one of the small flags, you'll see Russia, and Russia apparently has, I think, sub 100 cases last time I checked. Let me check again. Let me try to find it. Russia. I'll link it again for you guys so you can take a look. It's a pretty interesting stream. So many people watching it. Russia is our neighbor and we have 270 cases in Finland. Yeah, I don't know, it's a big country. Thing is about Russia though, Russia has high social distancing in the sense that, isn't Russia a huge country but it's all spread out, right? Like it's a huge country but it's actually very sparsely populated in Russia comparatively to other countries because it's so massive. You look at the country size of Russia, you think it might be one of the biggest countries in terms of population, but it's actually a really small country comparatively to its size, you know, physical size. So, and oh yeah, you know, it is definitely very cold. Russia took precautions and closed their borders in January. Oh damn. Very spread out. Yeah, the city's true. What countries have the highest natural social distancing? What do you guys think? In terms of people kind of just have more of a, this is pretty interesting, more of like a personal space between them. I don't know where America stands on that. I feel like we're kind of touchy-feely a little bit. You know, we shake hands, we, you know, when we go to a meeting, we shake hands, we kind of hug, we go to a happy hour, we do share drinks and stuff. Japan? Oh, true. But Japan's getting kind of afflicted by it, though. But Japan is extremely population. No, you're probably right, though. Japan, like, they bow when they're going to business meetings and stuff. You know, there's no actual physical contact there with that. And I don't know if they, share drinks and stuff like that as much. I'll put Japan definitely up there. Finland. A couple people said Finland. Why is that? I don't know too much about Finland.
Talk to me.
Russia is also plain cold. COVID is resistant to extreme weather, but it still can't survive sub-freezing temps. What do you think the temperature is like in Russia right now? Is it freezing cold? It's springtime, though. Well, definitely the Russian cold is insane, though. If you look back at World War II, and not even just World War II, no country has ever successfully invaded Russia, except for maybe I think people said the Mongolians or something. You guys hear about that? Like Genghis Khan. Maybe back in the day, I'm not sure. But I have heard that nobody has successfully invaded Russia. It's too cold. It's too strong. Why is Cargo's grinding peons? What's up, Ashley? I'm doing a quest here. I'm just not doing it very efficiently. I'm talking with you guys. I'm doing the Semiflange quest right here. Yeah, I know we're getting the news through every orifice these days, but as people say all the time, we love the Cargo stream because of how chill it is and his love for the game. Yelling at each other in doom and gloom chat is like other toxic channels, and I'm hoping we can keep it out of here. Let's create a little refuge. Hey, that's well said, yeah. I mean, I don't think it's been too bad in here. People are, I mean, in times like this, guys, we got to realize all of us are pretty much cut from the same cloth. We're all playing WoW. We like Warcraft. We like high fantasy stuff. Like, we're already kind of a small community in that sense. Gotta stick together, man. We gotta look out for each other. We gotta cook each other. We gotta cook each other's tendies. At Eve Tier 989 with the Twitch Prime. Thank you very much, man. Appreciate it. Mongols and various golden horde types have invaded Russia, but yeah, not since then. Yeah, true. Russia's insane. Okay, so let's hit this valve now. 10 hours later. This spawns 2 guys, though. We gotta be careful. Apparently, I think the only state in America, by the way, guys, that doesn't have COVID, guess what it is? I mean, you guys are gonna know this, but super random. I wonder why. Russia defense is OP. I mean, Russians are pretty badass, I gotta say. Like they're, they come off as a very strong, resilient people. You look historically, and you look at the Eastern Front, as they say, right? And like Russia, I mean, the Nazis and then pushing into Russia, and just looking at some of the stories from there. The Russian people are a hardy people, man. They are actually badass, I gotta say. Don't want to fuck with Russian people. Wyoming, Montana? Oh, is it there too? I thought it was West Virginia. That's what I keep hearing. I keep hearing. Let me see. Let me look it up. U.S. states without coronavirus. Oh yeah, no, only one state. It's only one state. I'm pretty sure it's West Virginia. Only one U.S. state has not reported a case, and that state is... What are they not saying? I'm pretty sure it's well. Oh yeah, West Virginia. As of late Monday, West Virginia was the only state that has not reported a coronavirus case. But the state was also among the last to gain the ability to test for the virus. Oh, okay. So they probably have it then. Yeah, how are you going to confirm a case if you don't have the ability to test? They're going to start testing now, though. We'll see. Yo, does anybody actually have coronavirus in the chat? It's okay, you can tell us, man, if you actually do. I feel like with this many people in here, there's got to be one person. I'm looking for a decent rating Horde server. Probably Incendius, Grobulus, maybe even Fairlina. A lot of these are like some of the servers that have big populations, pretty decent faction balance. How is Fairlina's faction balance actually? I know there's a lot of people playing on it, but maybe the faction balance is stuff. I would say #1 choice for me, if I was going to play on a new server and give it a real serious shot, would be Grobulus. Grobulus seems like so much fun. I have a hangover, does that count? Not quite. Not quite. I've actually had it. One of the first 3... No way. I kind of believe you for some reason. I've actually had it. One of the first 300 in Sweden. No way. Did you get pneumonia from it, man? Grays from Mothersucking Days in the chat? Dude, what? Is this the real Grays? Yo, I love the new emotes, Grays. There he is. That's actually him. What's up, Grace? How you doing, man? How are you, bro? You staying safe? Staying corona-free? Oh, White Mane? Yeah, that's true. I heard White Mane's pretty good. Alright, Semiflange. I'm undergoing self-isolation, getting tested tomorrow. Damn, man. Fingers crossed. I'm gonna be alright. I mean, if you were to get coronavirus, though, guys, this would probably be the best time to get it, though, right? It might even be the play, dude. What if you just got coronavirus now, got it out of the way while there's still ventilators, and then you were chill? You were, like, immune for, like, years and years. It's not even a totally glass half empty thing, because right now the healthcare system doesn't seem like it's too destroyed or anything right now. All the machines are probably still in decent numbers. It's still in the early innings of it, so even if you do get it, there's still even something there's still something kind of hype about that. Not even really immune, one small mutation and everyone's screwed again. I mean, your body's probably going to be better at fighting those types of viruses in general, though. It's the worst time. Hospital capacity is at a breaking point? I don't know, though, man. You think that the hospital capacity is at a breaking point now? We may have not seen anything with regard to that, bro. Like, what if in 2 months from now, 100x more people have coronavirus? Then you're really in a, you know, that's a whole other beast. Everyone talks about Corona. Can we talk about something else? It's the type of thing, though. I feel like if we were to talk about other stuff, I almost feel like there would be an awkward, like an awkward elephant. Or what was that expression? It'd be like the big elephant in the room. You know, like everybody's thinking about this stuff, right? It's affecting everybody. Get a little bit low here. Get a little bit low. I'm gonna go for a heal. Why am I so weak, boys? Why am I so weak? Why am I so just like unbelievably weak right now? We're ticking back up on mana. Nature's Grasp. Come on. Can't fight two mobs, yo. You need beer? I actually bought a bunch of beer. So, not even that I plan on drinking the beer. 1, it's liquid. 2, did you guys hear, anybody here ever watch the, anybody ever watch that documentary, How Beer Saved the World? What's up, Vaping Meg? How you doing, man? I'm doing good. I'm doing good. Just enjoying the lockdown. Trying to hang in there. There's a documentary out there. It's called How Beer Saved the World. Pretty good documentary. I watched it like a number of years ago. Oh shit, I'm low, dude. I'm low. Please don't resist. Please don't resist. Oh. God, I've never felt so weak on a character. I'm not even joking. I'm not even joshing you guys. I feel so weak on this druid sometimes. I haven't gotten skills in a minute, but... that documentary was legit, right? So you know that beer actually... They said that people who built the ancient pyramids were pretty much drinking beer. Okay, here's the thing about beer. So if the water supply does get contaminated or something... Alright, I don't know. Let me explain this the right way. Some big brains in the chat's gonna help me out here. So back even in the early days in America, when they were setting up America, the water was scuffed. The water wasn't clean, and they pretty much drank beer for hydration purposes. But I think it was a way milder version of beer. They drank like mead or something like that, which was like a more watered down version. But they pretty much drank that stuff to survive. So that's one aspect of it, that I feel like you could drink it in that capacity, in that light, if something were to happen to your water supply or whatever. 2, morale booster, which is definitely a real thing when it comes to survival and preparedness and stuff. 3, it's an amazing bartering tool. So, you know, people are going to get bored, or if stuff happens, you can maybe trade some beer or, you know, whiskey or something for some food. So beer I actually see is pretty valuable. Same with some wine. I got some bottles of wine as well yesterday. Bro, that show was great. Yeah, I really enjoyed that. The Egyptians did. Yeah, it was the pyramids, right? The ancient pyramids, they say. The workers were, I think they were paid in beer, or they were drinking beer, or something like that. Same in the Roman era, wine instead of water for drinking. There you go. Yeah, so I see it's definitely legit. There's a legit reason to actually stock up on beer or wine. And when it comes to hard liquor too, you know, back during the Civil War and stuff, when they used to do amputations and you know, these horrible things, they would just be pouring some whiskey on just to disinfect it. You can use the liquor as a disinfectant and also as a pain reliever. So if they were going to actually soft some dude's leg or arm or something, they would probably just give him a stick to bite on and give him some shots, you know, of whiskey, and then they would just go for it with the bone saw. Will there be a part 2 TBC train? I want to hear about other classes. Oh yeah, James, definitely going to make some more content on that. The bacteria died in the process of making the beer because of the boiling, making it a more healthy drink. There it is, the finisher. He appears. Yeah, the interesting thing that I learned the other day about bats, guys, with regard to this, no one knows exactly how this whole corona thing started. Some people say it was from a wet market in Wuhan. Some people say it was from this biochemical lab or something near wet market. I don't know, but one interesting thing about bats is that apparently they have extremely strong immune systems on bats. I don't know why, they just do. And they live in colonies, right? Bats are crazy. Bats are just crazy, man. Like don't they have you know, like that supersonic powers? Like even in Zubat and Pokemon, I always had that supersonic. They can see without seeing. They can use they can bounce sound waves, make little clicks or chirps and bounce sound waves, and they get to navigate like that. They get to, you know, navigate in the dark, and they're just these crazy animals. They have insane immune systems, so they can survive lots of diseases that we couldn't survive. So when you eat a bat, or if you mess with bats or whatever, and you start getting bats involved, they're carriers of these hyper developed diseases and viruses, because they live in these huge colonies of thousands and thousands, and they're kind of passing it back and forth with each other all day, every day. And you know, it's mutating, and then more bats survive it, and they have this kind of like expedited natural selection type of thing going on. So I don't know. I didn't know that about bats. So that's why there's a potential reason why you wouldn't want to eat bats, or handle bats too much. Maybe that's why the bat has always been seen as a kind of spooky animal. Yeah, true. Yeah, sharks are badass too. I mean, it always blew my mind, whales though. How whales can actually make a noise and ping that noise off stuff that are like miles away. Right? And, you know, pretty much locate things that are miles away, like a blue whale, right? Whales are just insane. What about sharks? Yeah, sharks are badass. There's a reason that most zoos do not have bats or vultures because they carry a huge number of diseases. Oh, vultures, huh? I could see that because they're always eating dead stuff, right? So they probably get all types of weird rotting bacteria and stuff like that. Interesting. A pangolin? What's a pangolin? Oh, that sounds like a Pokemon. Let me Google that. Pangolin. Dude, what am I looking at? This looks like a sand shrew. This looks like a straight up sand shrew. Kinda cute. Kinda looks sick. Dude, it's kinda cute, man. Pangolin? I never saw this in my life. Hey Cargos, are you on lockdown for real? Oh, no, I'm definitely on lockdown for real, yeah. For 3 weeks, Simon. Where are you from, my man? Yeah, the whole Bay Area where I'm from is lockdown for 3 weeks. Pangolins are dope. Dude, I never even heard of that till right now. Scary anteaters? They don't look... Oh, scaly anteaters. Yeah. That's true. They do look... That's what it looks like. I sent you an article on Discord. I'll check it out a little later, man. Oh no, everybody's on standby, Sora. Everybody's on standby, man. Thing is, Sora, I'm not actually fully trained up in one MOS or whatever. So I'm not that deployable in my current state because I'm kind of still like in a training thing. With that said, I can still be called upon and stuff, but what would probably happen is I'm gonna have to go to my local RSP and help out there. But a lot of guard mobilization, man, across the entire country. What does lockdown mean? So lockdown means pretty much, at least here in the Bay Area, you can only do essential stuff. So you can go to the bank, you can get groceries, you can visit relatives, you can go refill your prescription. You have to go to the pharmacy, but you're not allowed to go eat in public food courts. There's no restaurants, there's no movie theaters, there's no sporting games, there's no shopping at the outlet malls. Basically martial law? No, it's not martial law. Martial law, in my mind, is when you have someone with a gun pointed at your head if you break the law outside. Like it's a rule of law by force. The force is very, very like obvious in there. Why did this not work? Oh, I've used the console again. I'm so distracted. Martial law is when you have, you know, military personnel, I would say, or it doesn't have to be military, it could be police, that is, you know, forcing you at some sort of physical gunpoint or something to abide by stuff. Right now, it's not that. Like, you're not going to get arrested probably if you leave yet. You know, you actually might get. I mean, you probably get fined or arrested though. Maybe if you were doing something stupid, right? Like, what if you were at what if you threw a party outside and you have you throw a kegger in the park right now, and you invited all your friends and you put out a big blast and you're like blasting EDM music or whatever, and you're out there, you'd probably get like in big trouble right now if you did that.
Never felt so good.
Are you out in LA? No, I'm in the northern, bro. 25 uniform. Yeah, the AIT takes for a hot minute though. Actually, most of my friends are 25 series. Like most of my Army friends, 25 uniform, signal support, all that type of stuff. They got really good bonuses too, signing bonuses, but I don't know, the AIT's too long for me. They can call martial law over this, especially if they go into a nationwide lockdown. Well, what would you define as martial law? What is martial law to you? I don't think we're there yet. Is martial law ever appropriate? Maybe when you think of martial law, you always think of it being a bad thing. Maybe it's not always a bad thing. What if there's a bunch of rules? Like, what if it escalates and people are told to stay inside because it's getting really, really bad, and people keep breaking the rules? I don't know. Martial law is just government control. I mean, pretty much always live in martial law then. Guys, I only got 2 beers. Should I go buy 2 more for tonight's gaming? I would go buy a bunch of beer, man. It sounds like you might be a little bit lacking on supplies, my guy. People are being fined for being outside without a purpose in Spain. One guy fined 200 euros for being outside riding a bicycle. I mean, if he was just lollygagging around lackadaisically, I don't necessarily blame him. Why is he riding a bicycle? I feel like he could have easily gotten away with it, though. It's the type of thing you pull the guy over on the bicycle. Sir, stop. What are you doing out here? And he was probably like, oh, just going for a little, like, ride, just getting a little exercise, no specific agenda. He could have just said, hey, I'm going to go get some bread. I'm going to get some milk. Hey, I'm looking for some food. And he would have been fine. Martial law when the military intervenes. That's kind of what I thought it was, yeah. Come on. There it is. None of what is happening worldwide presently makes sense, especially because the death rate is not that high at the moment. Actually, the death rate, Sora, people are pretty shocked at right now. He replied he was exercising. That's why he should have had a legit purpose. Yeah, that's what I'm saying. He should have just said he was getting food or something, or visiting his grandma or something. But the death rate to a lot of these doctors is high. They say it's about 4% globally right now. But these are in very developed, advanced healthcare nations. This situation has taught me that everyone has at least one conspiracy theory that they believe. I don't know. I don't know if I believe any conspiracy theories. Let me think. What conspiracy theory do I believe in? I really don't think there is any. For me, personally. I mean, I'm sure conspiracies have happened, but I've never, like, really, let me think. Yeah, I don't know, man. I don't know. I think people are, I think human beings aren't that coordinated to, like, pull off these huge fake conspiracy theories, just personally. I honestly think people are blowing this stuff out of control, buying ammo and guns and stuff. I mean, ammo and guns are pretty useful to have. Ammo and guns, I mean, if you're buying an excessive amount, I hear you. Like, if you're loading up and you have, like, a whole garage full of 5.56 and stuff, but you should have some ammo and guns. I mean, if you...
Let's get this
ammo. Tuskegee experiments were a conspiracy. Oh, I heard about that. Tay-Tox, dude, good to see you here, bro. Good to hear you, bro. No coronavirus, you love to see it. Where are you from, Tay-Tox, man? Tay-Tox, big supporter of the channel, man. Good to see you still alive and kicking. Love to see it. Never seen more unqualified people act so confident. Is this YouTube chat? Act so confident in what way, man? Everybody's got an opinion on the internet, man. This is pretty tame. I feel like the chat that we have here is pretty tame compared to a lot of other places. You live in Phoenix, oh, okay. Not too far. Are you guys under lockdown there too in Phoenix? It's dangerous for me to get COVID-19. I have a weaker respiratory system. Oh, damn, dude. Hate to see it. Gotta do some, I mean, you can improve the strength of your respiratory system, right? Like, there's stuff you can be doing, man. Just do some jumping jacks, honestly, until you get your heart rate up, until you're breathing heavy. Just keep doing that. Stuff like that. I'm doing fantastic, just chilling, painting some miniatures. Oh, damn, that sounds like mad fun. I love painting miniatures. I enjoyed painting miniatures in Warhammer probably more than I enjoyed playing the game. I really, I really love doing that. I wish I had some right now. I'd paint some right now. Can we talk about the fact that 3 states have their primaries today and no one is showing up to vote? It makes sense, though. They're just trying to heed by the social distancing, man. I would say, I mean, they could just vote by mail, though, Taranan. You know you can vote by mail, right? Not a lot of people do it usually, but with this, they're probably just going to do that. Cargo, did the military teach you about meditation? Meditation? No, I never heard about that. They did in '86, huh? Damn. I mean, everybody has their own ways of meditating. I definitely think meditating is legit. Meditating is just, you know, being introspective, reflecting on things, giving yourself peace of mind. Would you say it's still safe to go to birthday parties? Whether it's safe or whatever is one thing. It depends on where you live, right? But you should probably respect the social distancing, so not try to gather in more than 10 people. So if there's more than 10 people, just, you know, try to make the sacrifice and then don't go there. Nah, man, only a few cases here in Arizona. Gyms and movie theaters closed down on their own, but nothing is mandatory. Restaurants and bars are still open. Oh, okay. It's probably coming, though, man. If it weren't for my ailing family, I'd go rub the bug all over me and become naturally immune as fuck. Warhammer bros be calling me Papa and Nurgle when I'm done. Dude, I wonder if that's the play for anyone. If anyone just tried to big brain it and get the disease early. When they're in good peak physical condition, there's plenty of ventilators, and they just took the L early. What server are you on? This is Bloodsail Buccaneers, my man. I wish I could stock up on guns and ammo, but it is not legal in Sweden. Well, you can own weapons, but they need to be locked away, unloaded, and disassembled. And you need to be an active hunter or sports shooter to own a gun here. You Americans do not know how lucky you are. Man, that is... I'm not gonna lie to you, that's kind of rough, dude. The thing is, that's kind of good news, though, is that the bad guys in Sweden probably don't have guns either then, right? The thing is, in America, probably all the bad guys have guns. No, you know what the thing that kind of would trouble me, though, is what if you're on like a 1v2, 1v3 kind of situation? Because, yeah, if they don't have guns, it's whatever. But then if you're against like 1v3, it's kind of GG. Can you show your macros? Sure, I don't have too many on this guy. The last druid I tried a lot harder. I had a bunch of macros. You need an absolute fuckload of macros when you play druid, though. It's kind of one of the downsides of playing this class. Like, I mean, I'm talking like 40 plus macros. Glad I don't need a gun to feel safe in my country. What about 1v2 or 1v3 though? I'm glad though. I'm glad, definitely. I'm definitely glad you feel safe in your country, man. But what if you just get like 1v3? This is going to be a strong case for people who haven't thought about 2A to think about how fortunate we are. Dude, I feel very fortunate, man. Absolutely. No, I feel very, very fortunate. We have strict gun laws in Finland too, but somehow we are close to the most armed nation in the world. Oh, huh. Basically every spell needs accounts for macro. That too, and also a what do they call it? Not focus, whatever. Mouse over. That's one thing. Not even just druids though. I'm pretty sure every class just needs mouse over macro for everything, because it just makes it just way better. Because there's going to be situations where that's going to be useful to have, and I'm very late to the party on that. I disagree with the gun thing there. Even if guns are banned and legal, criminals will still have guns. I mean, I'm not gonna argue with you on that, man. Like, the thing is about us Americans in a lot of ways, guys, I'm not trying to generalize too much, but we are a people that like tries to take things into our own hands a lot of the time. We're pretty individualistic in America in a lot of ways. You know, we're entrepreneurial, which is a sign of individualism, as opposed to like what is the other end of the spectrum, like collectivism, right? Pretty individualistic. So even if the data doesn't make sense, you know, and like we're statistically less likely to, you know, we're statistically less likely to go into harm's way if we didn't have firearms and weapons and all this. It's a part of our identity to a certain extent, like to be like kind of self-reliant, independent. You know, part of that whole thing is, you know, the ability to. I don't want to get into politics. Never mind. I'll take it back. But I'm not gonna argue with you there, man. All right, let's finish this up. Probably be a good officer. I had plenty of good ones. One butter bar we had went around for 3 months just taking notes. After that, he knew what was going on. He was a very good officer. Yeah, being in butter bar is kind of a meme, right? So you have to like try to not be the meme. Try my best not to be the meme. Thing is, I know about myself. Like I'm not some high-speed, low-drag, you know, airborne ranger, freaking, you know, hard charging into battle at every turn. Like I'm not that. I want to be a good quartermaster officer. That's what I want to do. Alright, we did salmon flange, that's done. Oh, prowler claws, we should do that over here. Yeah, these are the prowlers. Yeah, Mad Jelly for 2A in USA. Nice, yeah. Quartermaster officer, pretty much, you're like supply chain, logistics. You know, you're making sure that, you know, the different moving pieces have the supplies that they need to, you know, to operate. Making sure everything is in a good condition, everything is organized. You're monitoring that. You're in the armory, right? Like making sure, you know, all the weapons are clean and organized and accounted for and safe and all that type of stuff. It's like supply chain, you know. And some of the people that go quartermaster or go logistics or supply chain, they always say that there's a good translation into other jobs as well. Have you started Bullock? No. I actually had to recycle once through the traditional program, fortunately. But I'm not sweating it, man. Not sweating it. My old man was a logistics officer in the RAF. Oh, RAF, that's England, right? Yeah. I've like, you know, I've never been deployed or anything, but I have you know, a lot of friends who went downrange, and they were telling me that they always liked the Aussies and the English soldiers. So they're like very good, very good. All right, get these prowler claws. Actually, randomly too, I heard that there's some Swedish soldiers and stuff too, right, in Afghanistan and Iraq and stuff, like OEF too. Yeah, pretty much all DoD personnel right now, HDoc is on, like, you can't travel or anything. And people like, you know, PCS and orders to go to different places, everybody's just grounded right now. Even John, who's in here a lot, he's pretty much on standby. I scratched my nose while doing the turn and bounce. The LT told me to call him if my nose itched, and he would scratch it for me. Lol. So a couple days I called him and he ran over with the purpose and scratched my nose for me. That's funny, bro. A bunch of Swedish National Guard in Germany. Oh wow, they have National Guard there in Sweden too, huh? That's cool. It seems like Italy has some military in the streets and stuff too. I was watching some videos at checkpoints and stuff. Hey Cargos, recently got into your stream as well as Classic. Really enjoying both, I must say. One of the best Classic content creators in the biz, dude. I appreciate that so much. Thank you very much for the kind words, Jack. $5. The $5 of support.
Hey Cargos, recently got into your stream as well as Classic. Really enjoying both, I must say. One of the best Classic content creators in the biz.
LT Ramirez. Shout out to LT Ramirez, man. My ROTC buddy is 82nd and broke his ankle on the first jump with his platoon. Damn. I could never do airborne school, man. I know it's only 2 weeks. Is anyone like that, dude? Sorry, I think my dogs are going ham on a squeaker in the back. Jumping out of airplanes, though. Man, oh man, it's kind of the stuff of nightmares for me. I'm not scared of heights necessarily, but it's the fear of impending doom, which is something that it definitely bothers me. You know, imagine if you are free falling from 10,000 feet or something. Stuff of nightmares. Stuff of nightmares. Impending doom. Go outside and everyone is disobeying quarantine. Shaking my head. NA players, what's up, Navi? Good to see you, man. What do you mean? What do you mean? You're in DC, right? People are outside trolling. Let's see here. We're gonna go natural weapons. Yup. Big Navic in the chat. You love to see it. You really do. Coronavirus might interfere with my deployment. I'm pissed. Oh yeah, dude. Everybody's getting interfered with. Could you get someone to HC duo level with sometime soon? I'd be down. Yeah, there's a lot of interest in doing hardcore duo leveling. I think it'd be a lot of fun. Duo leveling in general is just amazing. Hopefully, if Navic's down someday, we can do some duo leveling hardcore. My boyfriend was a Marine. He says he feels no reason to ever jump from a perfectly good airplane. I hear that. I hear that. Thing is, Marines have to though, right? Freaking, I feel like the Marines do airdrops and stuff like that too. Maybe not though. Yo, do Marines have did they have aircraft? I know the Army has aircraft, but it's only helicopters, right? I heard that the Navy actually has more aircraft than the Air Force, and the Marines sort of like loosely the Navy. I wonder. Marines have their own air wing, but it's pretty small. Oh, I see. 3, 4, 5 man leveling is super fun too. Look who it is. Tactics Law, the legend. Look at him. Good to see you, Tactics, my man. How are things in your part of the world, my man? Big Tactics in the house. Ex-Navy Air Rescue swimmer can confirm Navy has a lot of aircraft. Yeah, I always found that weird, that the Navy has more aircraft than the Air Force. Give a link to the HC Tourney vid. Yeah, I got you. Sure. Platinum Wild did a great job with the trailer if you guys haven't seen it. Oh man, I'm almost scared to refresh this Corona thing, man. Let me see. Okay, hasn't changed much. I think they did one big wave of updates. And that's what it was. Maybe it was they didn't update it for a long while or some news story came out. Here is the coronavirus tracker thing that I've been watching. They update it every few seconds. You'll see it at the top right. Let me go find the video for you. the hardcore video. Here is the hardcore trailer. Platinum Wow made it. Who's a legend. He made us a little machinima, about a minute long, just to get everybody hyped up for the trailer. I thought he did a good job with it. All right. We can go do Harpy Raiders too while we're up here. Yeah, let's go do it. Because of aircraft carriers, better deployment. Out of all the deployments, it seems like the Navy have it the hardest. I gotta say, just because, well, in the sense that they get very limited access to technology or whatever when they're at sea. You know, apparently, I have buddies in the Navy, and you know, you pretty much load up like a a hard drive with all the media that you might need over like a long trip, and then you're just out there for months and months. You maybe get to use the phone or something, or maybe get a little bit of internet here and there, but that seems kind of rough, man. You got COVID? No, I don't have COVID, my man. I just have lockdown orders, shelter. Oh, wrong link. My bad. Did I link the Corona thing again? Oh, let me link it to you. 1 second. Sorry, I lost the chat for a second. If you were saying anything in YouTube for like the last minute, I didn't see it, my bad. Here is the, oh no, it was good? Okay, here you go. Oh man, so you ended up canceling the trip to Philly. Yeah, I did, pretty much. Got the full refund though. I was expecting that, honestly, to be an absolute nightmare to get the refund. Because you know how it is dealing with specifically American Airlines. I don't know what it is. I just have the worst experiences with them. I always feel like I get bad RNG or something. But I called American Air, and they were super chill about it. Oh, we got a tier 1 sub from Ursasu Byte. Week in and week out, supporting your boy. 41 total subs in the channel. You'll love to see it. Thank you very much for your continued support, Ursasu Byte, man. I hope you're doing good, staying safe, washing your hands, staying clean, stocked up on TP. Food, water, consumables. Thank you very much, brother. But yeah, I called American, right? And it was pretty well done. It was pretty professional. I got on the line, and they said, tell us your name and your number, and we'll call you back. It was one of those type of things, so you didn't have to wait on the phone, which was nice. And then they actually called back within the time frame. It was like 20 minutes. They called back, and then I talked to this lady, and she said, yeah, no problem. Here's, just use that same voucher, and you're gonna have that credit next time you want to book a flight. So if you guys have, a flight planned or something, it's really not that bad. If you're worried about getting your money back. Medical students just had clinical rotations canceled. I don't even know what that means, to be honest. Like their hospital rounds or something? Damn, Druid seems so slow. I'm not exactly playing like some high-speed gamer right now. I'm just talking a lot with you guys. Yeah, you go on clinical rotations as part of medical school in order to graduate and practice as a full doctor. So all of them across the board, the whole nation, are on pause or something? Is that a big deal? GMA soon, yes. I think probably Thursday or sooner we're gonna do it. Def Camp and Dunedin had a message this morning in the chat. They're down. People have been asking if we quit GMA. We have not. Just been slacking a little bit. A lot of missed encounters. What do you think about leveling as a rest, though? A druid rest, though? Do you think that would be more survival for hardcore? Let me see. I mean, you could probably do it. Thing is, you wouldn't want to go solely rest, though, or would you? You get Fury, which is great. You get NS, which is amazing for sure for survivability. NS is insanity. Insect Swarm kind of a non-factor. I don't see a world where you go just solo deep rest, though. You'd have to splash into it or something. Maybe go down to NS and race down to NS for the ultimate get-out-of-jail-free card for Druid, and then you can go Feral Balance. Going the whole way as rest, though, I guess you would just be like a kind of a nerfed cat form leveling, or maybe bear form. I don't know, it might be fine. Maybe it doesn't make that big of a difference on your damage going rest, though. You just have to try it out. GMA is Good Morning Azeroth. It's our weekly, well, it usually is weekly, we've been slacking a little bit. Podcasting where we just talk about the state of the game, all that type of thing. It has Def Camp, Dunedin, Melderon, and myself. It's like a podcast, yeah. I was at one of the major hospitals in my area for work, and they said their blood bank is down to 50% of normal since nobody is donating blood. Crazy how many things are affected you don't even think of. Absolutely. There's all types of indirect effects. When people say coronavirus is a meme and that we're young and that it's not going to apply to us, to me it just seems short-sighted. Because it's going to definitely apply to us in many different ways. Not all of the implications are going to be obvious at first, but you know, the next time you go to the store and you try to buy some eggs and they're not there, you try to re-up on some water and it's not there, you try to re-up on some TP or paper towels and it's not there, or even right now you want to go get some In-N-Out, you know, double with animal fries and Diet Coke, and you go and it's closed. You know, you're going to be feeling these effects, you know, in many different aspects of your life. You know, just the whole global, I mean, so here's one thing. This is why it's going to affect everybody. So the Fed, the Treasury Department, how much money did they print recently? Wasn't it something like a $1 trillion or something? So what does that mean? That means all of our money is worth less, right? All of our money is worth less because there's $1 trillion more dollars. So there's inflation. So your purchasing power of your dollar goes down. 1.5 trillion. Dude, I'm telling you, all of our money is gonna be worth less. So everybody's getting affected by this in massive different ways.
Strength and honor.
A lot of people are honestly kind of fucked right now, and I actually don't know what the solution is. The people that are most affected right now probably are the people that work. Let's think about this. Anybody who works in the restaurant industry, anyone who works in the hospitality industry, even people that probably work for construction and stuff too, like maybe those construction sites are canceled right now. How are these people going to make money? I really have no idea. I have no idea what the solution would be. It seems like an absolute headache. What else? I mean, airline industry, way less flights. Hey Cargos, a long time ago you had a big brain paladin on GMA. His name was Code Blue. Love that guy's take on things. How can I find some of his vids content? Oh damn. You remember Code Blue, Travis? I don't know if he has a YouTube channel, man. If you hit me up on Discord though, I can link you up with him. He's a nice dude. He always likes talking to new people. Man, that's crazy. Interest rate reduced to 0 first time in 100 years. Yeah, that's insane. How do you take advantage of that interest rate though? So we're thinking of refinancing. Because we're going to hold on to the house, probably rent it out eventually. Not even sell it, but just, you know, we're going to hold on to it for the long run, no matter what. So we're thinking about refi. Might be some other ways. Maybe just buying a new... So that's the number one way you take advantage of the zero interest, right? You just buy a new house. Watch the announcement of a gold-backed digital dollar. Old debt wipe, start again, rinse, repeat. I'm out of work right now. See, that's what I'm saying. It's scary. What do you guys think though about? They're debating this right now, giving everybody who's out of work $1,000 a month. What would the problems be with that? Or you think it's a good thing? I think it would be a good thing, but how are you actually going to pull it off? Like, how are you going to verify somebody isn't just trolling, just trying to get the money for free? How do you? There's so many. Maybe that doesn't matter so much.
For the horde.
Yeah, but how long can they do that? And that's more inflation. I mean, how do they? 1,000 would go a long way, though. I know it doesn't seem like much, but if you were in absolute survival mode, I hear you say, isn't that socialism? But at the same time, what do you do then? Freak out? Do they just have to go like rob people at that point? What happens if we do nothing and don't give them any $1,000? Like, what would actually happen? Is it gonna? I mean, I guess honestly they would have to find new jobs. But the thing is, who's really hiring in the coronavirus? 1K isn't even 1 month of rent. True. They did suspend all foreclosures and evictions and stuff because they don't want to kick anybody out during the coronavirus. Yeah, I mean, with 1,000 though, I'm pretty sure anybody could survive in America a month. I could, 100%. 100%. I've been down that road as like an entrepreneur and stuff. I could 100% survive on 1,000. You just have to like make sacrifices. You have to go to like Dollar Tree and buy some shit at Dollar Tree, and it's gonna suck. But you can definitely survive on 1,000. It's gonna suck. Absolutely. You're gonna be eating some freaking suspect food probably, but it would definitely help so much instead of getting nothing. There he is, Milan. What's up, dude? Ramen, hot buckets. Yeah, I mean, Dollar Tree. You can actually eat reasonably well from the Dollar Tree. It takes some effort though. Like you'd have to just buy rice and beans and hot sauce. Rice, beans, hot sauce. Probably get like some pasta and pasta sauce, and then get frozen veggies from the freezers in there. I remember back in the day, like years ago, when Dollar Tree was kind of like new. I'm in college or in the early struggling days of entrepreneurship and stuff. That was it, man. Go on Dollar Tree, you stretch that dollar, and it felt good. You leave there with a ton of groceries and stuff. They should suspend utility bills and rent payments if they lock down everything. Need a vitamin C source? Maybe. The thing is about vitamin C, this is what I always hear about vitamin C. That if you're just eating solid foods that are like relatively wholesome, relatively decent in terms of their macro and micronutrient contents, you're gonna get more than enough, like ample vitamin C and all of your vitamins from just eating foods. Now, if you're eating like highly processed stuff from the Dollar Tree, you might be right, because I think a lot of those micronutrients, vitamins, stuff gets stripped out through the processing. So you might be right on that front. But that is just one thing. That's one of the things that people say, oh, you need a multivitamin. A lot of big brains will say you don't necessarily need a multivitamin. If you're just eating decent, regular food that is not super duper 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 processed up to like the 5th layer of processing, then you should be fine. My current rent for my 1-bedroom apartment is $916. This doesn't include food and bills. If that was the case though, Scott, and it's coronavirus, now are you, and you're getting 1K, don't pay the rent. If you had 1,000 and that was it, and you weren't getting you weren't getting any other money, you would just have to prio and then just go through that process and just level with the landlord and just be like, yo, the coronavirus is hitting me hard, man. I'm doing everything I can, but with the 1,000 you could survive. I don't think there's anything unethical about that. You just have to, do your best. And if your total work is totally canceled right now and you have no ability to make money, and you need the money right now, fast, that's... Just be safe, guys. Drink 1 emergency packet a day. Those are pretty good. I like those. I have a bunch of those. When is the next hardcore tournament? Is there anybody contributor help? That's very nice of you to ask, Treasure. It's on the 28th. You can sign up to play on the Discord. I'll link the hardcore Discord for you guys. I'm assuming most of you are in there already. Maybe not, though. We got that host. Guys, if you want to participate in the hardcore community, get involved with the Cup. Oh, Pink Flamingo beat me to it. There it is. Thank you, Flamingo. Definitely check it out. A lot of good people in there. They're streaming there and help each other out. Also, vitamin C is mainly for cell regeneration. It's kind of a misconception about the whole immune system thing. It does help with your immune system, but not people think. Oh, there you go. It seems to me, guys, based on everything we've been talking about, the #1 way to improve your immune system right now and respiratory system, which is probably is that the respiratory system is different from your immune system, right? I mean, I'm sure they tie into each other, but respiratory system seems like almost the most important thing with COVID is to get cardio and exercise. So I got to man up today and do that with the wife if she's down. Just do some YouTube exercise, videos and stuff. It's kind of cringe, but gotta do it.